audience in different cardinal points of our planet who are listening to us all along these days. They are intense days on the second World Summit on MTCI. We have tackled with issues corresponding to traditional and integrative medicines, and we're going to talk about traditional ancestral medicine in the Americas. Today, we'll share with several colleagues their experiences on different areas of TCIMs. We're thinking that we're going to talk about interculturality, health, uh, different experiences and different peoples, also how they have inserted their traditional medicine systems in the healthcare system and services. We invite you to follow us through YouTube, Capsine for English, and YouTube of TCIM, BBC for Spanish, and for Spanish. I'm going to share my screen now to start this day with with a presentation of the first lecture. Please, Rocio, can I share my screen? Hello, Rocio. Is it being shared? Very well. Well, on this first keynote speech, we're going to introduce Dr. Sandra Del Pino. She's going to talk about interculturality and health. She is representative of the United Nations. She has been so since 2006. In 2010, she started to work on the regional office for the West Pacific at WHO. She works on cultural diversity in PAHO and deals with health and indigenous peoples, Afro and other ethnical groups. So she won't be here. She is going to be in a video sharing her presentation with us. And then we'll have Dr. Gutierrez to answer any questions we might have.
Muy buenos días.
Good morning. It's a great pleasure for us from the Pan American Health Organization to be able to be with you in this very important meeting, this second summit on traditional complementary and integrative medicine. Very important, not only for the Americas, but also the world over. From the ethnicity program at PAHO, it's a pleasure for us to give you an outlook of how we have been working on interculturality and health and its links with traditional and complementary medicine. First of all, we'd like to insist on the importance that the Pan American Health Organization is the first regional office of the WHO that has made an explicit link between different ethnic groups in a region, such a diverse region as the Americas, and the inequalities in health. This has also been gathered in a number of mandates to the organization, and specifically, PAHO has been working with 4 cross-cutting axes. First of all, ethnicity for the first time, and it's joined to the other 3 that are included and incorporated in WHO, such as gender, equity, and human rights. we're talking about PAHO, the oldest public health health institution in the world since 1932. It has 35 member states in 27 country offices. There, we have included these cross-cutting axes, and as I said, ethnicity is the first. In this way, PAHO is configured as a specialized agency in health issues, not only for the United Nations system as part of the um, uh, uh, for the WHO as part of the United Nations, but also for the regional office of WHO and PAHO. How have we been working on this? It's important to think about how the member states and the organization have made situations of health determinants visible in some groups, such as indigenous peoples, Afro people, and other ethnic groups in the region. These social determinant factors have been often translated in vulnerabilities, such as social and economic exclusion these groups face with structural roots in discrimination and in ethnic and racial discrimination. The situation has impacted the opportunities and capacities of people's lives with implications, of course, for their health situation. This is one of the perspectives of how we have dealt with ethnicity. And very important for our topic today is to approach the importance of culture from the differences of different peoples. This will require also approaches focused on different groups. In this way, um, the culture is considered as a good with implications for health. Along these last years, we have been working on what was configured as a first policy on ethnicity in health. This is the first policy the world over with such a topic. At PAHO, we had started working in the 90s on the health of indigenous peoples through the SAPIEN initiative, the initiative of the indigenous peoples of the Americas, that we had seen that other ethnic groups had not been involved in this process. Therefore, there were a number of consultation and debate sessions where we were able to have PAHO become configured as a world reference by including ethnicity. Translating that into the need of having differentiated approaches for working on health with different groups. These are populations that have been faced to inequalities, lack of access to quality basic services, and culturally affected. And this has been translated in worse health results. Along a number of consultation sessions, in a complex process, we unanimously approved the first policy on health and ethnicity in 2017 by all the ministries of health in the region. Then a strategy and action plan on ethnicity and health with specific indicators for that policy. The policy on ethnicity and health is accessible to you. It has 5 strategic lines. We can explain how this is translated into really doing interculturality in health. First of all, generating evidence. It's still in need and a priority to continue having reliable data that are representative of the health situation of indigenous peoples, Afro people, Romani people, as well as social determinants that have an impact on the lives of these peoples. In this way, we can have evidence-based political decisions. The second strategic line for technical cooperation refers to political action that is translated in promoting public policies that are intercultural and that tackle with social determinants of health. The third strategic line promotes the social participation and strategic alliances with indigenous peoples, Afro peoples, and other ethnic groups. And this means that any decision and initiative that has to do with the health of these groups um, have them as protagonists from the start. So they are not imposed. I mean, decisions are not imposed, but they come out from consensus with different world visions. The fourth strategy recognizes ancestral knowledge and traditional and complementary medicine. With this strategic line, we want to strengthen intercultural health models. It's important to remember that PAHO has been working with different tools, including intercultural dialogues or
Centrada
knowledge dialogues to emphasize attention focused on the needs of people and communities. And our PAHO team will be talking more about this. The fifth strategic line in our policy on ethnicity and health in 2017 refers to promoting capacities at all levels, not only fostering intercultural competences in our healthcare personnel attending to different cultural groups, but also foster the representation of indigenous peoples, Afro people, and members of other groups in careers um, in the healthcare area and also with intercultural contents. Um, Following approval of this health and ethnicity policy in 2017, in 2019, we adopted a strategy and action plan that goes from 2019 to 2025 with specific indicators through which different countries can measure progress made to improve the health situation of these peoples during that period. Because of time reasons, we're going to stop on the on strategic line number 4, which is the one acknowledging ancestral knowledge and traditional and complementary medicine, particularly because it's the topic of this World Summit. The objective in this line is to promote acknowledgement, respect, and protection of traditional, ancestral, and complementary medicines in the national healthcare systems. This is very important for the Americas. We know that oftentimes that is the first source of access to health for many communities. The indicators of the strategy and action plan will measure what countries have laws, policies, or strategies that acknowledge, respect, and protect and incorporate traditional, ancestral, and complementary medicines in national healthcare systems. That's one indicator. The other indicator is the number of countries that have institutional instances and guiding tools to promote respect to traditional wise people and central therapists in the healthcare sector. We'd like to give you some food for thought concerning to how this kind of health has been consolidated during the COVID-19 pandemics. We have been talking about population groups with an epidemiology mosaic that made them vulnerable in this pandemic, lack of access to quality basic services or culturally accepted services. It was necessary for these peoples to have differentiated approaches the inequalities they faced became more visible during the pandemic. Therefore, in the work we have been doing at PAHO in the context of COVID-19, we have been working, and it's important to highlight the impact that COVID had in the Amazon peoples, where indigenous peoples had a disease load that made them very vulnerable, among which TBC and malaria. Also, there were a number of obstacles at the beginning of the pandemic and during the pandemic for basic hygiene measures and also measures to keep social distance. This is why, in the pandemic context, it was necessary to have a differentiated approach for these peoples. Therefore, PAHO has been working, and we have incorporated that in our considerations regarding indigenous, Afro, and other ethnic groups during the COVID-19 pandemic. Well, we have incorporated ancestral medicines. Uh, um, we have incorporated inclusive and participatory consultation forums with representatives of different indigenous and Afro peoples at different levels from the most local levels. We also continue working with key tools such as intercultural dialogue for incorporating these perspectives and acknowledgement of different kinds of knowledge and ancestral practices. And we're also promoting cultural competences. We have also included, and this is very important for the current situation, vaccination that is effective mainstreaming of an intercultural approach in all the work areas, including the vaccination topic. Also, intersection with other inequities, such as gender inequities or those that occur along the course of life or the life cycle. We have also promoted articulated work between the healthcare personnel, leaders, and other key players together with PAHO personnel, taking into account structural racism that has been increased by COVID-19. With those considerations that have to do with indigenous, Afro, and other peoples during the COVID-19 pandemic, there are a number of recommendations that are included not only for the Ministry of Health personnel or Ministry of Health personnel that works with populations belonging to different ethnic groups, but it's important to continue working in incorporating the variable ethnicity and include public health information. We would also like to highlight the importance of campaigns, communicational campaigns that are culturally appropriate. Not only translation, but also any communication campaign should be really culturally adapted to the needs of different groups. And to do so, it's very important to continue working with the representatives of different communities.
Respect for traditional medicine, being able to contemplate different realities and different understandings about health and disease in this context of the pandemic. It's also important to take into account that these different ethnic groups in these different ethnic groups are taking, we are in the PAHO, we're taking into account the different points of view and cosmovisions, and we are trying to cover any deficiencies regarding the regarding COVID-19 by taking into account the cultural practices that exist, so that they are not contrary to the recommendations of PAHO. It's very important for the health workers to take into account the difference, the cultural differences, and the cosmovision. It would be very important also to do some analysis of the cultural tools as a key tool that we are going to continue using during the pandemic. From PAHO, we have also been fostering sub-regional consultations for COVID-19, not only with indigenous peoples, but also for Afro-descendants. And in these meetings, it was also pointed out how important the traditional medicine was, and to continue working to promote and respect cultural differences. And based on these high-level meetings with different ethnic groups, we identified 4 key areas for working during the pandemic. First of all, to promote, continue promoting equitable access to health services that are culturally sensitive. Secondly, to take into account the pre-existing health conditions that have an influence on the health situation of people, to take into account the information system and data in order to identify the priorities of these populations and monitor the actions. And fourth, dialogue and participation of different communities. The conclusions of these high-level meetings are also accessible online. We invite you to uh, take a look at them. And finally, we would like to thank PAHO for the invitation. We believe that traditional and complementary medicine is very important and um, extremely visible nowadays within this COVID-19 environment. And we will continue interacting with the PAHO team during the Congress on behalf of PAHO team. Thank you. Well, if there are any questions, well, if there are any questions in the YouTube channels in English and Spanish, no, there are no questions. So we will continue with the next presentation, which is the one from Dr. Ricardo Garcia and Mr. Medigueren Fernandez, who will be sharing with us the health situation of indigenous populations, challenges and possibilities. So I will pass on the floor to Dr. Ricardo Garcia. I will tell you a little bit about their CVs. Dr. Garcia has studied at the National University of the Peruvian Amazonian region and is a specialist in tropical forests. He has specialized in cultural interactions with the ethnic groups of the Peruvian Amazon region. And on the other hand, Mr. Mendiguren Fernandez is director of the Ministry of Health for Indigenous Peoples, and he has worked for more than 20 years also as a teacher and a lecturer at universities in Peru. I will share the screen of these 2 experts.
Micro, por favor.
Mr. Mendiguri needs his microphone to be turned on.
Licenciado Julio, ¿no se le escucha? Por favor, su micrófono
Uh,
podría desactivar.
Good morning, Ninoska. So whenever you say, we can start. Well, good morning, everybody, dear colleagues. Thank you for the invitation to participate in this important World Congress that makes visible the situation of indigenous peoples, but also the interventions the different states are organizing in order to close these gaps of inequality and exclusion that have been mentioned in the first part of this meeting. So I would like to use this presentation as a tool um, for my speech. And could you please, well, you can either show a presentation on my behalf or you can let me do it, whatever you wish. Well, this is a situation of indigenous peoples in general, trying to emphasize what is happening in Peru, and we have coordinated with Engineer Garcia so that he can intervene in the second part in order to supplement the information. The geographic information is the following. Here we can see that in Latin America we have about 45 million people that declare that they are ethnically related to indigenous people or belonging to the indigenous people. They represent 8.3% of the region's population, and there are at least 522 indigenous peoples and 420 different tongues, different languages. Here you see the population for each country. In Peru, and this is very interesting, about 1/4 of the population, according to the National Census of 2017, self-identifies as indigenous. And in Peru, we have Andean indigenous peoples and Amazonian indigenous peoples, and we also have Afro descendants. So almost 7 million Peruvians that identify themselves as indigenous. And this is interesting because services, the state services have to be differentiated for this population according to our constitution. So the services provided by the state must be provided by respecting their traditions, their values, their beliefs, and their languages because they are part of our heritage. And of course, we have to develop and respect their sense of belonging. In Latin America, almost all countries have important percentages of their population that self-identify as indigenous. In some countries, it's much more than in others. In case of Chile, 11%, Argentina, 2%, Uruguay, 2%, in Paraguay, almost 2%, Ecuador, 7%. And in the case of Bolivia, it's 62%, Mexico, 15%, Guatemala, 41%. These are the countries where we see a greater presence of indigenous people in the demographic composition. The next slide. I lost the sound. I'm sorry. Mr. Mendibur turned off his microphone.
Micrófono.
Doctor Julio, su micrófono está cerrado.
Gracias, gracias. Sí, decía
Thank you. Sorry. Yes, I was saying that in the Peruvian case, we have 51 Amazonian indigenous peoples distributed among 11 regions. And in the case of indigenous and Andean indigenous peoples, we have 4, Quechua, Aymara, Uros, and Jacaros. The last ones, Jacaros, are in the Lima Andean region, 4 or 5 hours away from the capital. And these people survive and have endured different changes in the geographic and ethnographic structure of the country. They preserve their tradition, their cultural traditions. We have elder members of these people that are still preserving the traditions. We have been able to accompany them in the vaccination process we are trying to promote. So in all countries, we see that indigenous languages are still being preserved. Next slide, please. And here you see that in general terms is observed about indigenous peoples. The indigenous population has high percentages of poverty and extreme poverty, and this social condition puts them in a situation of vulnerability. For example, malnutrition and anemia are very much present here, and they are accompanied by the lack of other services. For example, the monetary condition, especially of Amazonian indigenous peoples, we have found that about 40% of these families live in a situation of poverty or extreme poverty, and this is about 3 times more than the non-indigenous population. This is the clearest proof that the situation of indigenous peoples is difficult, complicated, and deserves a differentiated and prioritized attention. And there are some signs, for example, also in terms of education. In the case of Brazil, less than 1% of this population has access to higher education, 2% to secondary school, and about 20% to primary school. And this indicator is more or less the one that is repeated in the native communities in general. In Peru, for example, we have observed that 1 of each 10 children, or up to 2, has access to university. And this is because of the social programs such as scholarships. And almost half of them have a possibility of finding a job immediately. And the life expectancy of indigenous peoples is lower than compared with people that are not indigenous. Less than 25% of the indigenous population belongs to the elderly group. And it's very difficult to find in some indigenous communities people that are above 65 years of age. And this reflects also the inequality and exclusion in general, and it has increased their vulnerability to climate change and especially to the pandemic caused by COVID-19 that we have been enduring since last year. And this is also increased by this vulnerability is increased by their limited access to water and sanitation services. Um, that their lack is about 40 to 80% of these people's lack water and sanitation. And in border areas in Latin America, the situation is even worse. So in the case of the pandemic, what we have seen during the pandemic is that they uh, prefer to isolate themselves sometimes, and sometimes they have been isolated because of the situation, so something which affects their well-being. This is a social situation that has a great impact on their state of health. And next slide, please. In the case of pandemic, this is what what the countries have done in order to face the issue of health and the pandemic. Because of cosmovision and ancestral practices, the childbearing percentage is very high among indigenous and Afro-descendant women. And the situation of the Afro-descendants is more or less the same. In Guatemala, for example, 58% of indigenous children suffer chronic malnutrition, and 23% this malnutrition is really high. In Panama and Peru, infant mortality is 3 times higher than in indigenous populations than in non-indigenous population. In the case of Chile, for example, the mortality of young indigenous population is almost 4 times more than the general population. And so the situation of indigenous peoples is endangered, and especially now during the pandemic. 62% of children, indigenous children in the region, have some kind of or have a lack of drinking water, and the fertility rate is 2 times higher in comparison of the fertility rate of non-indigenous population. So in general, the health situation, especially of the indigenous population, is um, in a very delicate situation. But this is due also to the lack or deficiency of public policies and the limitations of the relationship between indigenous peoples and the state, because this puts them into a situation of vulnerability. There's lack of participation in the public life of the country. And now we can see, to those of us who are working on the fields, in the field, this is very similar to in other countries of Latin America. So what have countries done in this context of the pandemic? First of all, several of the countries, if not all, have implemented action plans in order to prevent and control and mitigate the impact of COVID-19 in indigenous territories. In the case of Peru, we have implemented an Amazon plan, which was based on 2 pillars: prevention through the distribution of alcohol and face masks, and also cleaning products, pulse oximeters, for example, thermometers, and other kind of articles that were distributed to the elders of the communities. And on the other hand, we deployed community health agents, health promoters, and also we tried to overcome their isolation in order to distribute oxygen and also outboard engines for their boats so that they could have access to the nearest towns. We distributed about 80 million dollars in these articles, but at least last year the indigenous population suffered very much under the pandemic. 20,000 people were affected, and almost five well 500 indigenous persons died, and there was also a response from the organizations, the indigenous organizations themselves. They revived their traditional practices with the participation of community health practitioners, and these have been central and important aspects in order um, to uh, fight against the pandemic. And the health ministry has supported this through some guidelines that for the prevention of respiratory infections that were adapted to the specific situation of the indigenous people. For example, also for the self-isolated groups and dealing with, for example, the bodies of the deceased. And the contribution of some NGOs and organizations has been also very important. We have the famous COVID-19 indigenous commandos, and they have been implemented in all the regions. And it's the first time that the indigenous authorities and leaders were at, came together with the regional governments and the authorities of the state in order to plan the actions against COVID-19. This has been very much valued by them and has helped to contain the pandemic. This is to show you the impact of the pandemic and how we were able to contain them. In the Peruvian case, we had about 20,000 cases of COVID, and this year about 2,500 cases, and last year about 100 deaths, this year about 42 deaths. And so this shows that this alliance and our work of intercultural dialogue and the enhancement of ancestral practices has helped against the pandemic. In the Peruvian case, however, the situation may change because we are getting new cases of the Delta variant. In the case of the Andean population, we had 5,000 cases last year, and this year more than 3,000 cases. So we have a lesser impact, but in terms of deaths, it has been more or much higher than is the case with Amazonian populations.
¿Cuál es la intervención sanitaria más importante en este momento?
What is the most important health intervention, the most important public policy for the countries, and especially in the Peruvian case, because this is the one we know best, and that's vaccination against COVID. We have established dialogues with the different associations and the organizations. We have worked with the Ministry of Culture that defines the public policies in the case of indigenous peoples in Peru. And we have decided to vaccinate more than 3,000 people in against COVID-19. The vaccination brigades go into the communities accompanied by a previous dialogue with the elders of the respective tribe, and also one of the issues is especially the lack of information. So we have started um, to distribute this information to make it reach the population, because people have been very much afraid. Some people have also said that vaccines are the brand of the beast from the religious point of view. And it has been said that they will die about 1 or 2 months after the vaccine. These are myths and beliefs that have limited the progress of vaccination. But even then, um, in present times, vaccination is a very important thing because we have more than 30,000 tribe members that have already been vaccinated. We are almost at 40,000 now. And here you can see, well, this is our goal for the Amazonian peoples. They are over 300,000 people that have to be vaccinated or should be vaccinated. And this has started very successfully. They belong to more than 3,000 um, towns or villages in 11 departments. We see that people are changing their attitude and they are welcoming the vaccination brigades. And this was not so last year. So they have been informed about the benefits of vaccination. The brigades also take physicians and qualified nurses with them in order to be able to interact with the population. And there are also health practitioners and some citizens of the communities that accompany these brigades in order to distribute information and to be able to make progress in that sense. It's quite difficult to carry out, but the commitment of the health teams is also very important. And there are also financial and logistic limitations because we need fuel, we need air transport, river boats, and this is not so abundant in these regions. So um, these factors have been limiting vaccination. But we're making progress, and here you will be able to see how vaccination is making progress. I believe it's the same thing in all the countries. Here we include the private sector, the churches, the indigenous peoples, the professional associations, the universities, but especially also the regional governments. And all the ministries are working together in order to bring hope, life, and health to these populations. I will finish here And to give the floor to my colleague, up to yesterday, no, up to Friday, uh, 36,000 vaccines were provided, 26,000 first doses and 10,000 second doses that have been administered to indigenous peoples in the Amazonian region. So we are at about 10% of the target population after 3 weeks of starting the vaccination in this region. The vaccine used is a Sinopharm vaccine because they are available in the country, and the cold chain is not so difficult to maintain. They require temperatures from 2 to 8 degrees, in contrast with the Pfizer vaccine that needs a very cold chain. So as you know, you take about 5 to 6 hours to reach some of these populations. So it's difficult to use for them because you have to transport the vaccination brigades for 6 hours. Well, in
Finish
order,
this presentation on my side, which has been a quite general view. These are images of indigenous peoples being vaccinated. The testimonies of community leaders have been very important. Here we have ministry people supervising a vaccination, and also, as you see, the people in charge of vaccinating are wearing uh, clothing that is specific in particular to different indigenous populations. This is how vaccination is progressing, and we think that at the end of August or September, we must have concluded with the vaccination among Amazonian indigenous peoples in the Peruvian case. A couple of slides more, please. Next one, right. Well, these are tools that the Ministry of Health has made available to strengthen health interventions in the indigenous peoples. First of all, making up 8 regional indigenous COVID commands. They are dialogue platforms and spaces for planning and articulating in equal standing with other official entities. This initiative has been valued by the people's organizations and the ombudsman in the Peruvian case. Also having the scoreboards so that anyone can have access to databases and analyze morbidity, mortality, and even follow up budgetary execution aimed at indigenous peoples, because historically these peoples do not trust managers. So having open data for specialists so that the different analyses can be carried out generates trust. And that's part of government transparency. Together with the German cooperation, we now have a mobile app concerning self-learning. It's for free. It's available for any who is interested. This is how healthcare personnel self-educate on intercultural aspects of their work. This is for professionals, for healthcare promoters, and for any other professional who would like to start working in native communities. And we'll have different specific interventions in collaboration with cooperating bodies. I always highlight the coaching aid, etc. of UNICEF, the German cooperation, the Red Cross, PAHO, with whom we have been working to strengthen the use and registration of ethnic variables that help us to have better health interventions in indigenous peoples and some other sectors. Also for dissemination, generating messages with cultural relevance and to broaden and expand cultural dialogues. A final slide will help us understand some challenges that we think are important for improving the indigenous people's health. First of all, I think it's very necessary in all of the countries in Latin America to have facilitated access for indigenous peoples. And we need to overcome all kinds of barriers, particularly geographic, economic, cultural, and of course, organizational. Secondly, it is very important to improve healthcare indicators. And this means investing in indigenous people's health. They take care of our forests, they preserve our culture, our languages, and also they are the ones who have the least in their vulnerability condition. They require more and better care than that which has been given to them historically. So we need to improve coverage in terms of mother-child care and vaccination. That's an imperative. And it's in all the countries. There are countries that have made more progress than others. And of course, we need to reduce the impact of COVID through differentiated care, working with traditional medicine agents, also implementing intercultural education policies. And of course, vaccination must be successful for the indigenous peoples, but it has to be informed and consented, respecting their worldview, their beliefs, their ancestral practices. Undoubtedly, deepening and articulating participation of indigenous organizations and their leaders, valuing ancestral knowledge and and its incorporation in the healthcare system. And this way, indigenous peoples will be able to have access to health supply. We can have modern infrastructure, of course, with cutting edge technology, but it's not necessarily relevant for the population. So this is why we have designed infrastructure that is appropriate for these communities. As from this year, we will have intercultural healthcare modules adapted to each reality, respecting beliefs and customs.
Está en Andoas.
A multi-sector committee in Andoas, a district very close to Ecuador, will start with dialogues and these works that will be, as I think, an icon for differentiated care to indigenous peoples. And I agree with the lecturer from PAHO in terms that we need multi-sector and intergovernmental approaches for indigenous health, because there are many factors that determine the health status of indigenous peoples. I think that these challenges and others that will be identified by other participants will tell us that the state and different government levels will need to close these gaps soon, sustainably, and permanently. I pass the floor. Thank you very much. Good morning to you all. It's 9 a.m. here in Peru. The next slide that complements what my colleague mentioned we need to highlight the indigenous peoples' numbers in Peru. We have 55 indigenous peoples. Can you hear me? They are in 51 Amazonian peoples and 4 Andean peoples. They have 48 indigenous languages. All this information is in our website. We have 8,984 places where they live. They're divided in 4,907 peasant communities, 2,303 native communities, and 1,774 settlements of other kinds. In the last census in 2017, we found that 4,500,000 Peruvians have an indigenous language as their mother tongue. 5,900,000 Peruvians feel they are or consider themselves as indigenous. This is the horizon we have as a country in the context of COVID-19, with also the information and vaccination also mentioned by Dr. Mendiguren. Well, here, perhaps we should talk about the regulatory framework. It's important to mark before and after moment concerning the pandemics. We have adapted our regulations and forms for indigenous peoples. Last year, we issued Supreme Decree 004/2020 of the Ministry of Culture to guarantee relevance and cultural adaptation in care given to indigenous peoples. This has to do with adapting services, strengthening human resources, adapting public services culturally, and involving indigenous peoples. Decree 005 to incorporate the ethnic variable in state records has to do with identifying the administrative record to be amended or modified. The methodology to incorporate the ethnic variable, which we didn't used to have. In this way, we have a real recording of what's happening on site. An anecdote here, while COVID-19 was starting and everything was new for indigenous and mestizo peoples, public services and the Ministry of Culture followed cases, and they told us that there were no cases reported among indigenous peoples, but we had contact with leaders in indigenous organizations, and they reported cases of indigenous peoples that were coming back from cities to communities. That articulated effort with a ministry, between the Ministry of Health and the Ministry of Culture, helped us to realize about this, and we incorporated the ethnic variable in our records to identify the health conditions or the health status of indigenous peoples. These three last decrees are very important. 008 has to do with transporting and delivering goods and or foods to indigenous peoples. It is related to actions before delivery and transportation, something of concern because with supply of first need products, we needed to comply with some health protocols, and those protocols were given by this Supreme Decree 008. The executive branch and the Ministry of Social Inclusion, Development and Social Inclusion provided basic food. We have delivered thousands of tons of food to indigenous peoples. We have 010 too. We think it's important that it marks the before and after the pandemic. That has to do with implementing alert strategies to identify COVID-19 suspect cases in indigenous and Afro peoples. This has to do with identifying alerts of suspect cases, communication with informers and patients. In this case, it has been leaders of communities, organizations, and other allies, such NGOs or the private sector, with whom we have coordinated to have the information and reach them with culturally adapted care. Following and monitoring cases, each case that came up in the in indigenous peoples were followed up by the Ministry of Culture, managing information and report too. I'll show that later on. This alert system is very interesting. It is witness of joint work between the Ministry of Culture, the regional government, in this case Loreto, and the leaders of indigenous organizations. We were able to land a proposal that was built together with them and which has been very beneficial for indigenous peoples. 012 has to do with creating a service or of indigenous languages, interpretation and translation. This is face-to-face or remote transmission of indigenous language speaker to have access to a prioritized public service, and also written information that is a priority for them in indigenous languages. First of all, this has to do with preventive information, with all the regulations and protocols and biosafety that were issued by the executive branch to prevent COVID. And also afterwards, vaccination. Julio has already mentioned that we have a very big challenge with this vaccination um, um, because there's a lot of misinformation. Indigenous peoples receive that misinformation and they believe things that leaders tell us on how the population is thinking, and they think that's also a barrier, and we're jointly working with providing the right information. The public sector does so, but we also have allies who do this, sorry. Concerning vaccination, there are some key factors. Leaders are a key factor. At a region in Peru, the regional organization of Ucayali, Orau, and its leader, Perlin Enriquez, was vaccinated. And this was an example for the rest of the population to see and generate trust. Trust must be generated with the right information provided by the public sector. And in this way, and also this information has to be culturally adapted. Here, I'll talk a little bit about the strategy I've already commented about. This is a strategy of early information and alert. The Ministry of Culture generated the system that aims at informing and sensitizing indigenous and Afro peoples on COVID-19 prevention and contention measures and vaccination process. Specific objectives are preparing informative messages adapted to indigenous and Afro peoples, disseminating informative messages where they live, and monitoring and doing follow-up. As for point two, messages, we have generated many relationships with the private sector and strategic allies that work in indigenous territories to be able to share information with them. It's no secret that in the Peruvian jungle and in almost all of our South American countries, This is communication is a very big barrier. We do not, we have not covered that need yet. And this is why we think it is urgent to have strategies to have our information reach those territories. This is the map of Peru. We have intercultural promoters in 13 regions of the country. 10 of them are in Amazonian and Andean areas, and 3 monitor and see cases in Afro peoples. Next one, please. In this case, I'm showing a map of Peru concerning follow-up and monitoring in indigenous peoples and the number of allies and informers. We have leaders of indigenous organizations, always respecting their institutions, and some NGOs and private sector allies. There we can see that the largest region of the country, Loreto, is monitored till May. And you can see all the other departments as well. In Loreto, we have 1,627 that are monitored, and we have 232 informers there. To date, we've had 26,000 cases monitored, suspect cases. That was in 2020 and 2021. It's important to highlight that 2020 saw the highest peak of suspect cases. At the beginning of the first and second wave, and I'm going to show you a video about this to give you some context. And the so-called triple border between Peru, Brazil, and Colombia, we have the Ticuna people. And this is one of the areas where the first wave started, and the second wave started in Loreto. It was the Manaus, the Brazilian variable. And this is, well, in the first wave, the Ticuna people and other peoples, but particularly the Ticuna people, was seriously affected by COVID-19. The Ticunas started to see how they could provide care to their population. They are about 3,500 people. They have a health post that couldn't cope. They just gave complementary care. This indigenous people had 7 deaths due to COVID-19. And the government started to report and to provide care. Many calls were made, and also the Taita plan that has to do with comprehensive care was provided to them. That was taken to that area. We have itinerant platforms of social action, mainly geared towards attending to rural population. And there were several services provided by them. At the beginning last year, we had COVID testing and also some medicine and provided. And now we have comprehensive care given also with information on vaccination. There you can find the kind of traditional medicine they have been using. I mean, the Ticunas have been using in their community, Bellavista, Cayaru, in the Cayaru ravine in the province of Ramon Castilla. So I'd like to show you the video. In that way, you'll see how we have provided care to that indigenous people. Thank you very much, engineer. Now we will continue with the video.
Yo soy el alcalde delegado del centro poblado,
I'm
Bellavista.
the delegate mayor of Bellavista de Cayaru. My name is Ángel Román Rubens. What's happening here in the community and also all over the world, as we have seen, we're going through this problem. We're suffering that disease. And 5 people died because of this disease. I don't know how many have been infected. We have several people who were infected, but it's stopping now because these people are recovering and we're trying to stop the infection. The ticunas are stopping that with our herbal plants. I'm from Bellavista Cayarí. Unfortunately, in my village, where we have 3,600 inhabitants, and we are ticunas, and indigenous people. As I said, unfortunately, we are abandoned by government. We don't have a good health post that is well implemented. We have no medicine that fortunately, we do have a lab technician, 2 nurses, and also 2 assistants, but we need more support. We should not have only a health post because we are many people. We need to have better care. We also need medicine for this pandemic that arrived in our village. 7 people died, and we need government support. Thanks God, thank God, we have this trunk. It's called chanango. We can make preparations to fight this COVID-19 epidemic with it. This bark is called copal. Here, we have ginger. This is garlic. We have remicaspi bark. Also our regional lime or lemon. This fruit is called uña de gato, cat's claw, and this is called cordoncillo. This bark is copaiba bark. And this is huacapuruna bark. All these plant elements we see here are cooked. When it's already cooked, I sift it and I have a clean liquid. And all of this we see here is useful to fight this epidemic, COVID-19. We defend ourselves with this, and we have good results. We have evidence. There are people who have recovered without going to the doctor or hospital, without any injections, without any other support from doctors. So thank God, he has helped us to know about this medicine, and we will continue preparing it for our people and for all the people who might need it.
Muy bien, con eso se ha
Very well. With this,
transmitido el video que ellos han querido compartir.
we have shown the video they wanted to share with us about their medicinal plants. And so now we are going to ask some questions, receive some questions from the public, read out these questions. One of them is for both of you. What is the state doing for the indigenous peoples in order to strengthen their traditional medicine? Maybe in Mr. Ricardo, Mr. Julio could answer this. Well, in Peru we have a national center for studying. It's a research center that studies the therapeutic functions of a series of plants, herbs, barks, etc., that are medicinal plants. But in the country, we are also, and this is more important, we're working on the intercultural policy. And this includes also traditional medicine as part of the focus for healthcare of the indigenous populations. For example, we are setting up an intercultural plan for the Loreto communities and native peoples that are in the area of oil extraction, where, for example, the government is committing itself to take up traditional medicine into the development plan. And in the case of the Peruvian government, we have very little staff or very little or even a healthcare staff, and even in some cases no healthcare workers. So because it's not very attractive for physicians or nurses to go and work in these areas, so we are trying to incorporate community agents into the treatment plan for a third COVID wave. And we are also incorporating traditional healers into this plan. So the community agents could be traditional healers that have been also been trained, and incorporate them into the group of ministry agents. And well, this has been so in the past also. Many of these traditional healers are incorporated into the state as state agent. The same thing is for childbearing. For example, the midwives and traditional healers also act for the Ministry of Health in childbearing cases. And I can also add something, Ricardo. Well, apart from that, it's important to mention that in Peru, we have had a committee, a multi-sectoral committee for COVID-19, where all national or organizations from the whole territory participated, also the traditional peoples. And so, because of, well, thanks to the debate and the cooperation among us, in May this year, we have set up a very interesting space, a very important one, because it will have a great impact on indigenous peoples, which is a permanent commission to propose, implement, and control the health, the care cooperation with indigenous peoples. So there are different working groups in this committee. One of them is about indigenous development, and here is where we are going to incorporate the traditional knowledge. This is an important milestone, and we believe that there will be a better cooperation between indigenous and traditional institutions and peoples and the Peruvian government. This is what we wanted that's what I wanted to add. Thank you very much, Ricardo. There are some questions also, or one question in the chat about, oh no, it's to Dr. Gutierrez, who is in the room. It has been mentioned that Afro-descendants are considered indigenous peoples, but indigenous peoples are the ones that were there before the arrival of the Spanish. Why are Afro-descendants considered indigenous peoples? They were not there. Were they there before the arrival of the Spanish? Well, I have problems with the video, but I mean one video, but I can answer that. They were not mentioned in the same category. If you refer to Sandra Del Pino's presentation, she talked about ethnic diversity. For PAHO, it's indigenous populations, comma, Afro-descendant populations, etc. Thank you for this clarification, Dr. Gutierrez. And we have another question for Dr. Ricardo or for Mr. Julio. Are these traditional healers receiving a salary, or the cultural managers, cultural agents? Well, this is a difficult area, I have to say. It's a demand from the indigenous communities to set up salaries for community health agents and traditional healers. In the Ministry of Health, they are considered voluntary agents. But and so what we do is provide them with some incentives, such as food products, or maybe the payment of transport means. But it's not a monetary transfer that could compensate their dedication and their time. And provided with transportation means, they are they are given food baskets, etc. So I believe that the proposal will be for our countries that these community agents could become specialists in intercultural health services with a training program. And this would mean that we could also measure their productivity, and strengthening the first level of healthcare it would be a very good intervention. So I believe that there will still be it will not be immediately. Just now, we don't have economic incentives or salaries paid to these agents, but there are plans to strengthen their technical equipment, the kits they need, for example, and also the basic pharmacy products. They are just provide, well, the monetary compensation has not been established yet. I don't know if in other countries it is so. Ricardo, do you want to add something? Or yes. Well, in the case of intercultural managers in the Ministry of Culture, these are people that also belong to the indigenous peoples and that have been hired by the ministry under contract, and they receive a salary for or well a payment for the activities they carry out with indigenous peoples or Afro descendants. We thank Dr. Ricardo, well, Engineer Ricardo Garcia and Mr. Julio Mendibure from the Ministry of Culture and Ministry of Health. Thank you. Now, we will start the conference of Dr. Germán Zuluaga, entitled Traditional Latin American Medicine. Dr. Zuluaga is a physician with a master and also a doctor's degree in epidemiology. He is specialized in traditional healing in the indigenous Afro-American and mixed race communities, and he works in intercultural affairs for the University of Rosario in Colombia. He has sent us a video because he's just now on a field trip. Rocio, can we show Dr. Zuluaga's video?
Muy buenos días.
Good morning. I would like to thank Dr. Marta and Dr. Yana for their kind invitation to participate in this event, and I would also like to congratulate you for this effort. I hope that this will support and enhance the knowledge about traditional medicine. I was asked to do a presentation on traditional medicine in Latin America, perspectives in present times and future times. And I will start, first of all, in the definition of traditional medicine and understand that the so-called traditional medicines were studied among social sciences in the Western civilization, ethnography and anthropology. So it was an anthropological issue. And during the last part of the 20th centuries, the ethnobotany, ethnobiology, ethnoecology, and ethnomedicine programs and disciplines were started, also focusing on the herbs, the herbal medicine used and by these peoples. And since 1978, the medical sciences deal with traditional medicine. So in 1978, with the Alma Ata Declaration, the WHO set up traditional medicine office in Geneva. So the idea was to incorporate traditional healing into normal health care. So In Latin America, PAHO developed the new classification or a new concept of traditional healing and traditional medicine. This strategy was renewed in 2014 and is still in force. For example, in this virtual library for health, there is a portal for traditional health care and also complementary and integrative medicine. And traditional medicine was included among the disciplines. But I would say that Western medicine is still very far away from incorporating traditional medicine into public health care. What we call traditional medicine includes from home remedies with concepts and beliefs and diagnostic and therapeutic resources to more complex structures. So PAHO in 1997 decided to call them traditional health systems because those peoples that still preserve their territories, their language, and their traditional systems of knowledge incorporate traditional medicine into their civilization. So a second problem in dealing with traditional health systems is this issue of shamans, medicine, and religion, because it's still very confusing. Is shamanism a religion? Is it a traditional healing system? Well, it existed in the whole world in the past, and it was incorporated into the traditional systems, but it is a concept that is not very well defined. Each people, uh, each group of people has defined their own system of medicine and healing. It's simultaneously religion, medicine, social organization, territorial order, and also productive systems, reproductive systems, individuals, and society. So shamanism is a sort of broad concept that includes all these complex areas. What is a shaman? Is he a physician, a healer, a priest, maybe military chief? So is this traditional medicine or something different? It would be useful to understand that with the arrival of the Spaniards in the Americas, we found three different types of indigenous peoples. The ones that live in the high mountain areas where the medical systems were structured, where they had medical professionals. And so during the next centuries, it came to a process of incorporation and syncretism between the two systems. And then, well, I'm talking about the Andean peoples in Mexico and in South America. Then we have the lowland peoples that have a low level social organization, and the shamanic systems are very very widespread, and it's very difficult to separate religion and medicine. And the conquest and colonization was later, and there is a low degree of mixed population. And so the Amazonian peoples are still part of these lowland peoples. And then we have the peoples that are located between the high mountains and the lowlands. This is, for example, on Sierra Nevada, the case in Sierra Nevada in Central America and in the outskirts of the Andes in South America. And here we have, well, the adaptation was a survival strategy. So the structure of these traditional knowledge system were different when the Spaniards arrived. In the high mountain peoples, we found a traditional medicine system. In the among the lowland peoples, the functions were less differentiated, and the shamans were, well, had a series of roles. They were traditional healers. There were also chiefs and military leaders. And in the well, the term shaman has to be read in its own terms. The translations we try to invent in Spanish or other languages is something like grandfather, the priest, the healer, etc. So shamans are something difficult to classify. The conquerors understood that these people exerted the control and authority in their communities. This is why the strategy was to persecute them and exterminate them. So, in destroying the heads of traditional systems of knowledge, they facilitated colonization. The figure of a priest or a chief or well, the head of the people disappeared in almost all cases, and the shaman was considered the equivalent of traditional healer, which was the only way they could survive, covered by ways of syncretism, especially with Christianity and adaptation to the colonial power. So, with the passage of the centuries, we go on from shamanism to traditional medicine, which is a generalization that can be understood in several ways. So we can find presently we can find three different systems of traditional medicine. On the one hand, we have knowledge systems that are more comprehensive than only medicine. For example, the shamans in the jungle areas, the Amazonian peoples, the Mamos of Sierra Nevada, Santa Marta. And then we have the traditional medicine practice by in the high Andean areas of Peru and Bolivia among Quechua and Aymara, the healers and wise men of the Maya Quiché, the Taitas and traditional healers of the Colombian Amazonian areas. And then the traditional medical traditions that survive in a partial and fragmentary way in the mixed blood population, for example, with with herbs, herbal medicine, and also the midwives, etc. I would like to give you some examples. This is a picture taken with the Hoti indigenous people that were recently contacted in Colombia. They suffered an epidemic of viruela, an epidemic that almost exterminated them. So we had to detect which were the traditional healers, the priests or the political heads, and there were no separated figures for these. And so the function of the physician or the priest or the head of the community were not differentiated. So they allowed me to be present in a ceremony of 3 days. The epidemic was one of smallpox. And this is the Maroca ceremonial, that is the traditional ceremonial lodge where we have these religious leaders, and what we see behind is also a sort of hospital. It's a health agency. There we have the surgeons, the epidemiologist, the gynecologist, the pediatrician. Well, this is a way of looking at it, but none of these definitions is the right one. And I was able to accompany them for 2 years in Colombia, in the Sierra Nevada, for the intercultural dialogue. And here the mamos are not traditional healers in the strict sense, and they are not priests. However, they do perform both tasks, and they are also in charge of social organization and territorial division and governance. So, and this is a typical example of the cayahuayas, the famous cayahuayas in the Bolivian Andes, on the lower mountain chains that are near to the jungle area. These old shamans were considered only traditional healers. Here you can see this is the Taita, which is who is a traditional healer and who heals the patient in a personalized and individual way, and as in the Occidental tradition, and not through collective ceremonies as before. Here we see a midwife from the area of Buenaventura, a healer from the high Andean mountains, or here we see a healer and a midwife. These are expressions of the traditional healing that has been diluted throughout the centuries. I would like to ask, can we say that there is a mixed traditional Latin American healing or medicine after so many years of interbreeding, a cross blend of all cultures. Some of them are almost they are still indigenous, or others are almost white, and most are mestizos, and they have different concepts of health, cold and heat. They have the bad air, etc. And there are traditional practices, for example, initiation rites, care during menstruation, during pregnancy, and during the aftermath of childbirth, etc. This is a text from anthropologists Carlos Pinzón and Rosa Suarez that tell us that there is another America that is being built, that is a mestizo America, that is below what we can see, but that has the same point of view as before. These are traditional medicines, popular religions, or popular religions we haven't solved, really. We haven't solved this dichotomy. And I would like to end by showing you some challenges for the future. The first one is that we are accepting epistemological diversity and cultural diversity and judicial pluralism. And so we also have to accept the coexistence of different medicine systems, different ways of understanding the world also. And each one has its own complexity and its own edifice. The traditional knowledge systems have been deteriorated. Sometimes we do not have the three floors of the three stages of the pyramid, knowledge pyramid, but they are complex systems and we have to understand them as such. This is what, this is the uh, idea of UNESCO, so of investing into intercultural dialogue and cultural diversity. We are talking about building bridges with traditional knowledge. So it's not a case of doing research about them, but of incorporating them. As Western scientists, we do not have the right or the permission to invalidate knowledge bodies that are different from ours. And but we are invited for an intercultural dialogue, and I believe only in this way we will be able to approach this in the best way. And so we have the commitment to build a medical ethics body for the research with indigenous communities. We have committed a lot of crimes against our indigenous peoples, and they are really tired of receiving so many experts, so-called experts, because for centuries we have patented their plans, we have stolen their knowledge, and we have published them without their permission. There has been no consensus in research and no previous consultation, so they are really very angry with us, and we need an ethical point of view that completely respects their rights and their knowledge and traditions, so that they are no longer objects of research, but also the subjects of
Concern is
this
more and more extended.
research.
The world over, there is an interest in protecting traditional knowledge. The task is not so much know them and approach them. If we don't guarantee their juridical protection, that's inescapable in this approach. Therefore, if we want to have a dialogue with the traditional medicine and the national knowledge systems, we need to understand that we need to build different methodological tools that are different from the Western scientific method. And we're building that. An epidemiology applied to traditional knowledge that we can call an intercultural epidemiology. Above all, the most important, in my opinion, is to contribute to conserving and recovering traditional knowledge systems, and not only what we call traditional medicine. It's not only preserving the herbal healer or medicinal plants or others. This includes everything: territory, culture, environment, language, and particularly traditional knowledge systems. This is why we commit to understand that, first of all, we need to preserve the heads of the traditional knowledge system, guarantee permanence and transmission to next generations, and other productive projects in health, education, environment, etc., will make sense. Otherwise, they won't. This is why we prefer to talk about territories of life and try to understand finally that there is an intrinsic relationship between nature, health, and culture. This is why we take a slogan: we need a jungle to weave a crown, and we need a crown to have a forest. Thank you very much.
Agradecemos la presentación tan
We thank the
emotiva por una
very
parte del doctor Zuluaga y esos
emotional
abordajes
presentation
a través de los
of
diferentes
Dr.
especialidades
Zuluaga
de la
and
medicina tradicional y nos ha dejado con un
different
mensaje
approaches
como
to
nosotros
traditional
como
medicine. And his
sociedad
message is that we need to think about building an intercultural epidemiology,
la cabeza
preserving
de la medicina
the
tradicional.
head and the body of traditional medicine. We thank Dr. Zuluaga for his excellent presentation. Now,
Unos videos en esta pausa que tenemos de
we will share some videos in this break we have of 15 minutes on Bolivian traditional medicine. The first video was made by Dr. Alexander Panda and the National Museum of History in La Paz, Bolivia. They have some interviews to traditional doctors on the use of different plants, and there's a video on the Callahuayas already mentioned by Dr. Zuluaga. We will see the grandness of these healers that have been acknowledged by UNESCO as cultural heritage. With the support of doctors of the world. My name is Marta Laura Mamani from Cayapi. Healing power of plants.
Esto se cosecha en la mañana.
This is harvested in the morning. Then we wash it, dry it. Then, only then, we can use it for ointments, for poultices, and we can also boil it, and we also drink it. Yes. Santiago de Callapa municipalities in the Bajajes and Ticacita provinces, the Esteban Arce of the Aroma province and the La Paz department, several traditional healers give support to the natural and traditional medicine labs created in Spain and Bolivia and different healthcare centers in these municipalities as a complement where these biomedics work on a daily basis to improve local health. They use native plants or those that have been introduced, like rosemary, ruda, parsley, garlic, aloe, and others. They have healing properties, and they are carefully planted and harvested in these greenhouses, because in this way we can make sure they are of good quality and we are sure about their origin. This is Andisweya. It's quite good. Externally, we can use it for poultices, and internally we can take it. It's an anti-inflammation plant. Once they're collected, they're artisanally dried. We put plants loosely on mesh covering wood support. In this way, we can dry it slowly without the need of using ovens or chemicals. This is already dried, already to process. After drying, these traditional healers use plants directly in infusions. They can also be milled, and plants that are now in a powder and used for ointment. With these dry plants, whatever they are, whether they are plants that are whole leaves or milled leaves, they use ointments, poultices, syrups, and others, or they pack them in bags directly for their patients. It's very important to have this kind of greenhouse and labs for producing artisanal medicine, because in this way we preserve very valuable natural resources. They're valuable both for traditional medicine and the population at large. These plants are collected and processed in the right environment. They have a sure origin, differently from those collected in places that are exposed to contaminant agents or that can be confused with other species. Contrary to the right species, they can impact health negatively. That's a case of Equisetum giganteum. Instead of that, Ephedra rupestris is distributed.
También cabe mencionar que este tipo de
We should
emprendimiento
also mention that this kind of entrepreneurship provides a larger quantity of resources as compared to gathering plants in an open area. In this way, it satisfies demand and is an economic factor of prosperity for those involved. Callahuayas, with the cooperation of UNESCO in co-production with Quipus Cultural Association and the participation of the Callahuaya Ayllus, or villages or peoples, Callahuayas. Life tradition, wisdom that heals. They're the children of Alpamani and Pachamama. They are Callahuayas from the eastern Andes of Bolivia. They bring knowledge whose origin is lost in time. They're Callahuayas, the one that have knowledge and bring wisdom. They know the arcanes of nature, and they have deciphered its magic. They live in Chari, Chajaya, Huancaya, Wata Wata, Inca, Turbat, Unuturin, Tabata, all communities in inter-Andean valleys, the largest mountain range in the world, in the Amazon, the richest biodiversity region in the planet. They live close to Charazani, the provincial capital.
El tiempo son los
Le solicitamos sus disculpas por la transmisión.
Please excuse us for this transmission. We're having some technical problems with the video they shared with us.
Por lo visto,
Apparently,
ha habido algunos problemas.
there have been a few problems with this video.
Retomar.
We'll see if we can pass it again. Well, the idea with this video was to share the experience of Kayawaya healers, their knowledge, how they see medicine, and how through their world vision they treat people. So we'll have a few minutes of break to then continue with our transmission. Thank you very much. I just wanted to comment that some questions which have not been responded in this retransmission will be answered through YouTube in the Spanish and English channel respectively. We thank you for your understanding. This is technology that is not always at our side. However, our intention in developing this summit is a very good intention of sharing all these experiences.
Vivo.
Muy bien, ahora vamos a compartir, vamos a entrar en la sección de los
Okay,
paneles.
now we'll be sharing our panels with you. There we will introduce different lecturers in this panel. First of all, we'll deal with experiences of articulating traditional ancestral medicines in North America and Central America, challenges and perspectives. Our first panelist is a traditional doctor, healer. He is an elder. His original name is Ni Gana Aki Inini. He, in Spanish, this means leader man of the land. He is an elderly of the Anishinaabe community, devoted his life to sharing indigenous knowledge, taking a message of hope, peace and environmental respect. He funded a Turtle Lodge for the education and well-being of Indigenous peoples. He comes from Canada, and he will share a video that has been pre-recorded, and we will listen to his presentation.
Bonjour, Anin, Dene Magnetuk. Nigani aki, Yenene, Ndigo. Kenyun do tem, Saging Donji. And Ishnaben Dao. We are living in a world in need of a great deal of healing. The Western healthcare system has certainly improved health from a physical standpoint. The science and technology of modern medicine has proven remarkable, such as in handling infections, injuries, and managing the symptoms of many chronic illnesses. Yet, in spite of these accomplishments, humanity has not been able to arrive at or address the root of illness. The way of Indigenous peoples has always been to seek a holistic approach. We begin by acknowledging that as human beings, we are comprised of four elements: spirit, the emotions, body, and the mind. All these elements must be brought into balance to have a healthy life. It is said in our lodges that our bodies are the temples of our spirit. We need a strong, healthy body to keep the spirit giving us the inspiration to do what is morally right. The current food system is filled with so many chemicals contributing to many of our illnesses today. We are eating very little natural foods where chemicals are not being used. We must take some responsibility for the poisons that we are putting into our bodies. Our minds are sick, which impacts every part of our being. The mind today is overwhelmed with information that is causing confusion, fear, grief, anxiety, frustration, anger, and hatred. The mind is led to believe the state or the government knows what is best for everyone. Racial intolerance and mistreatment towards people of color has become so obvious. Despite the challenges all around us, the massive amounts of information, the unfairness, the daily news about violence, climate change, and pandemics, we must still take responsibility for keeping our minds clear and positive. Our emotional being reflects how we are feeling: happiness, love, peace, sadness, anxiety, fear, anger, or hatred. When you go to a traditional healer or elder, the first question they will ask you is, how are you feeling? The thoughts in our mind determine how we act out our feelings. One of the most powerful emotions reflected in the media and social media is anger. The minds of many are overwhelmed by negative thoughts. Many don't know how to handle anger. The elders would say, you darken your heart with anger that quickly turns to hatred. The emotional being of an individual contributes to a negative or positive impact on their well-being. Our emotional well-being depends on living in an environment with more joy, more happiness, more emotion from the heart. If one is angry, this leads to a negative impact on the whole body. It works against the natural immune system. It is our responsibility to balance our emotions. We need to find grace in life that at times will be sad, depressed, and hurt. When the knowledge keepers of our nations make reference to our health and well-being, they say we must go back to the beginning. What they mean by that is going back to the spirit. We are spiritual beings living this human life. The elders say the most important element of our lives is the spirit. Our spirit is where we began. Our spirit holds the key to our identity, purpose, and the original instructions we were given to walk in this physical world. Spirit is the foundation of our physical lives. We have come from spirit, and upon the end of life, our spirit returns to its original source, the spiritual realm. Our spirit is part of the great spirit, the great mystery we were created from. Explaining this part of our nature is challenging simply because it goes beyond words. It's beyond the capacity of the mind to fully understand this part of our nature. It is the spirit that defines the identity of any living being. For example, an oak tree has a spiritual nature, otherwise it would not exist. Within the seed of the oak tree is the spirit that provides its life, identity, purpose, meaning, and instructions on how to be an oak tree. The tree itself has great strength. The fallen acorns feed many animals. They are used by humans to make flour and roasted to make coffee. Oak planks were historically used for Viking longships. Oak is used for making furniture. The Japanese use oak for making professional Yamaha drums. Oak bark is what is used to make corks. Known to have healing properties, oak bark is made into a tea or added to medical preparations. Rich in tannin, the bark is also used by tanners for tanning leathers. These characteristics are all part of the identity, gifts, and uniqueness of the oak tree. Every living entity has been given an identity with its purpose, meaning, gifts, and instructions in the circular web of life. This brings me to the point of our spiritual nature as human beings. We each have a spirit that we can see so clearly in ceremony, a shining blue light. All living beings have this shining blue light. The shining blue light of the oak tree gives its identity to look the way it looks, with its many different attributes and abilities. It is the same for us as human beings. Our shining blue light gives us our physical features, complete with an identity that defines our gifts, and there are many. The biggest challenge we have is to know our individual gifts and use them to help create a more peaceful and loving world. The spirit resides in the heart, which triggers the heartbeat. In spirit, we arrived into the world of our bodies with the original instructions on how to live and behave as human beings. These instructions held the laws and values of kindness we were supposed to be showing to each other, and to our mother, the earth, who would provide everything we would need, our food, water, medicines, shelter, clothing, and the love, connection, and guidance a mother has for her child. We are of the earth herself. The laws of spirit and the laws of nature provide us with everything we need to live a good life in a sustainable way and to fulfill our destiny. Today, the world suffers from a spiritual identity crisis. We have not lived in a way that is guided by spirit. It is our minds that has overpowered the voice of our own heart. We continue to walk the road of purely mental thought. The mind does not have the ability that the spirit has. Our spirit is what connects us to the greatest intelligence and energy of the universe. The spirit carries the genetic memory of our true purpose as spiritual beings. The mind, disconnected from the spirit, tends to be more concerned with power, control, greed, and materialism, and it creates separation. It has created this thought that man, through his mind, can dominate nature. This has caused the continued exploitation of our original mother, the earth, with no regard for respecting natural laws. This sense of ownership over the land is missing the critical understanding that man is responsible for the land, for taking care of the land, and for following the natural laws of the land. What is missing is the understanding that the land is alive. She is a loving being who enforces her laws to bring the creation back into balance. According to the teachings heard in our lodges, 4 original races were created and placed in different parts of the world. It was said that a day would come when the 4 original root races of humanity would come together, creating a spirit of unity. Each representative would bring knowledge and understanding, and as a collective would bring a greater understanding of life with our universal purpose to be caretakers of the earth, not dominating the earth. We are now in that time to unify from our uniqueness of identity within the human family, rediscovering our identity as unique members of the human family is fundamental. We all have gifts to share and an identity complete with original instructions on how to take care of each other and our home, Mother Earth. There is a new life, a new world that is emerging from Mother Earth, correcting the imbalance that comes from humanity not following the natural laws. She is reminding us of the natural laws, laying down values that act as the foundation of sustainability of treating the earth with care. It will be the economic ideology that will have to change. The earth cannot continue to support lifestyles of luxury and lavishness. In the great wisdom of the knowledge keepers, they have always cautioned, be careful how you treat the earth. For what you do to the earth, you do to yourself. As much as we have polluted the earth, our minds have also been polluted, filled with fake news, continually bombarded with negative information, including the disempowering idea that the institutions know what is best for the people. The mindset of the corporate world, the governments, and most people is that we can continue to dominate the earth. Most institutions support this mindset, entrenched in the government and corporate circles. This is wrong. Politics is the game of the day, polarizing and entrenched in opposing secular ideologies. Added to the politics is something more dangerous, a level of frustration, anger, and even hatred that has the potential to create much more violence. We are in some dangerous times. The indigenous knowledge keepers would say, "Wewe ne," be careful and do not rush when you have to make an important decision. Look in all four directions and look and think things through very carefully, making a decision that does right by our sacred laws and by our children and future generations. The Anishinaabe people have evolved with 7 sacred laws for many thousands of years, laws inclusive to all life that help us to be kind and to live in a good way on Mother Earth. The ancestors of our nations left us a footprint, a path to follow. The foundation of that path has been the 7 sacred laws, which came to our ancestors through visions and dreams. As the first peoples, we've always been guided by our visions and dreams in the same way as other spiritual traditions around the world. These laws represent the foundation of our identity as a people and can set a new foundation and a new narrative around the globe that is inclusive in respecting the diversity of the human family. There are 7 animals that represent the 7 sacred laws, beginning with the law of respect brought by the buffalo. The essence of respect is to give, just like the buffalo who gave its whole being for the life of the people. Love brought by the eagle is about loving the Creator and Mother Earth and loving ourselves the way we were created and loving each other. The eagle brings vision based on love. Courage brought by the bear is to live from the heart, to have the courage to be ourselves and to do the right thing for the sake of the children, the way a mother bear would die before seeing harm come to her cub. Honesty brought by the Sabe or Bigfoot is to be honest, to speak truth from the heart. We are not to lie, to judge or condemn others, rather speak well of others, honoring their uniqueness. Wisdom brought by the beaver is to use our gifts given to us by the Creator to build a peaceful world, just like the beaver uses his gift of sharp teeth to build. If he didn't use his gift, his teeth would grow long and he would die. If we did not use the unique individual gifts we have been given, we would not fulfill our true purpose on Mother Earth. Humility brought by the wolf is knowing we are all equal in the eyes of the Creator and showing gratitude for life received. Truth is represented by the turtle, who is one of the oldest animals and who has seen life evolve. To live truth is to walk all 7 sacred laws together. We have arrived in a time when we need to build on values that support life. 2 common concerns can unite us as humanity: our love for our children and the issue of accelerated climate breakdown. These 7 sacred laws can act as the foundation for anything we create as we create a better world. We have a healing and teaching lodge in Manitoba, Canada, called the Turtle Lodge, where we are making efforts in what we call Indigenous knowledge and understanding. It is within our belief system that we are to live in balance and harmony with the earth. This requires living from a foundation of laws and values, having a spiritual relationship with the earth. We are in the process of developing land-based education geared towards survival on the land, including teaching our original languages. A major focus has been on supporting the youth in their rites of passage to adulthood When we take the young boys at the age of 12 or 13 to the land for 4 days and nights, to fast in prayer and ceremony, to be initiated by Mother Earth, and to ask the Spirit to bring them their vision and purpose in life. The young girls starting their moon time are taken to the grandmothers, mothers and aunties who teach them about their sacred role as the life givers of our nations. We need to change the narrative internationally to a paradigm based on a foundation of values, spiritual and natural laws. True humanity is built on the values that stem from the heart, being kind, humble, and showing respect, loving all of creation. Mentorship by knowledge keepers can support the youth in knowing and feeling the land. Knowledge keepers can lead by creating earth-centered education approaches, including rites of passage and ancient approaches of connecting to the land. Learning to read the book of nature gives our youth the best chance of surviving following natural law. The land has an intelligence, a heart of kindness, and can provide direction in how to live in a sustainable and respectful way. There is no one panacea to solve all problems. Nature operates on the principle of balance, working together with diverse approaches based on sacred values keeps the balance. Together we can develop Earth stewardship initiatives, grounding scientific knowledge with a foundation of natural law. Indigenous knowledge keeper-led places of education should be supported with proper investment. An international education campaign of Indigenous people sharing their knowledge of our relationship that has sustained us for tens of thousands of years should be supported. When we begin by reestablishing our relationship with the earth, we will find our way out of this world that is not sustainable. We will achieve justice and oneness, knowing we are all brothers and sisters, united by the heart.
Muy bien, un mensaje muy emotivo
Yeah, very well. This was a very emotional message, full of love and respect for Mother Earth, and respecting also the laws of nature. And as he said, maintaining a relationship based on balance with the environment, with ourselves, with the spirit and the space around us. It's a very emotional message. He is a person that has shared um, shared ideas with spiritual leaders such as the Dalai Lama, and he, as a person, has had a great influence at the world level. Now we will proceed with the second stage of this first panel. I want to introduce Dr. Hernan Garcia Ramirez, who is a physician, and he specialized in social medicine, research and strengthening of health in rural and indigenous areas. And he is Deputy Director of Complementary Systems of Health in Mexico. Dr. Hernan, you have the floor. Well, good morning. We thank you for this invitation. Right now, I am going to share my screen. I will talk about the experiences in articulating traditional indigenous medicine in Mexico and challenges and ideas for the future. In Mexico, we understand the traditional medicine as a series of systems of healthcare that are based on profound knowledge of health and disease that the different indigenous, Afro-Mexicans, and rural peoples of our countries have accumulated throughout their history. And we have as a third root the Afro-Mexican peoples. We consider traditional indigenous Mexican medicine as a complete healthcare system, and we have systematized it and ordered it by working together with many indigenous peoples and by using the systematization theory of medical anthropology. The legal framework, well, the Constitution recognizes the right of indigenous peoples to preserve their culture and used
La Ley General de Salud está
peoples
como
and communities of Mexican descendants are also recognized in Article 2 of this Constitution. And the General Law of Health also recognizes this. We know that traditional medicine is very effective with a series of different elements, and in many places in Mexico, we identify traditional medicine with the herbal medicine, but this is not the only element. It's a very important element, but not the only one. There is, for example, the physiological benefits of traditional massage or tomascal and other features. In the legal framework recognizes especially the wealth of herbs, of herbal medicine that we have in Mexico. We recognize them in a pharmacopoeia, in a herb pharmacopoeia of the Mexican states. I want to tell you about the social situation in which traditional medicine is applied. These peoples, these indigenous people, suffered a series of processes that we call impoverishment processes that have to do with taking away from them their traditional foods, herbs, and medicine, and even their lands and their traditional roles, their knowledge, and also economic mechanisms of exploitation. And this in some way is validated by transcultural processes, educational processes that break down indigenous identity. So we say the indigenous peoples are vulnerable or maybe vulnerable populations. So many indigenous peoples have responded with mechanisms of resistance starting, well, in the colonial times up to nowadays, facing this situation. In Mexico, we have a situation of traditional medicine that although it is recognized in our legal framework, there is still no recognition from the health services as in a more specific way, a clearer way. There's a lack of support to traditional midwives, for example, although it's supposed to be one of the goals of the new traditional, of the new laws about healthcare systems. So, of course, there is a loss of interest in the young people to be trained as traditional midwives. Science is getting closer to the cosmovision without considering what the real roots of it. They look at it with the benefit for the benefit of markets and laboratories. So with the exception of massage, they are not studied by science. We recognize that there are three types of relationships of institutional medicine with the traditional medicine and midwifeship. It considers traditional. One point of view is it considers the traditional medicine as a primitive element, such as the traditional midwives, for example. Or there's a horizontal way of looking at this, of symbiosis. We see that in many other countries, this is also the way to go. It's not a subordination we are looking for. So, on the one hand, we want to strengthen the health services with traditional medicine, uh, based on this idea that it is one of the objectives of the goals of the system. This policy is linked to the national policy for intercultural healthcare of indigenous and Afro-Mexican peoples. This is a document, this is the link to these documents. And the strategies we have in that sense to develop a traditional medicine is a census of traditional therapeutic therapeutes, the organizational strengthening and the strengthening of services of traditional medicine, including midwives. And by strengthening the health services, we try to promote mechanisms of intercultural relationship and also a horizontal exchange of knowledge. It's difficult to have this horizontal focus, this horizontal point of view with regard to traditional medicine. It's very difficult because Western trained physicians are very proud. And although we have hospitals with traditional medicine, as we have in several states, such as Puebla, it's difficult to establish this horizontal and intercultural communication. The other strategy is to set up a basic chart of herbal remedies. We recognize herbal remedies such as a herbal remedy as a preparation based on herbal plant, on medical or medicinal plant. It is derived from the popular knowledge, and so we facilitate the traditional people sell that indigenous people sell their traditional remedies, and the good practices are in this sense are difficult because there are lots of rules and regulations about that, so it's difficult for them to sell them. We also have the strategy of green pharmacies, where the traditional herbal healers prepare their products according to safe guidelines, and they are offered in the healthcare centers at community level. And so this benefits the inhabitants of the regions, of several regions and their hospitals. And we have the strategies of getting the actors of traditional medicine to set up their own processes for recovering the knowledge and teaching. And we recognize and develop the traditional care system for pregnancy, childbirth, and afterbirth period through the traditional Mexican medicine. So there we favor the meetings for or meeting at a horizontal level for an exchange of beneficial practices. The National Commission for Human Rights gave a recommendation in 2017 against the repression of midwives, against the discrimination of traditional midwives, but it is a right in the Constitution to choose a traditional midwife, and we had an event with the Supreme Court of the nation, and there was a round table about human rights and intercultural health, and we came to the conclusion that the care of traditional midwives diminished childbirth and newborn diseases and deaths. In the state of Chiapas, the women can choose, for example, who they want to be with, or who should care for them during their pregnancy, if they prefer a physician, a Western physician, or a traditional midwife, and if they want to choose their own to wear their own clothes or the hospital clothes. So what we do in those cases is ask them to bring, if they choose to wear their own clothing, they should bring it to the health center, clean and ironed. We have issued guidelines for facilitating this participation of traditional midwives in childbirth and prevent discrimination. And as a strategy, we also have these posters where we show what can be done with traditional medicine for other parts of the country and the world. And as a strategy, as an important strategy that we started at the beginning of 2020 was the support given by traditional remedies for COVID-19. So we tried to find out what the traditional healers were doing against COVID-19 and what the effect was. We studied it in a scientific manner. We also found that many women wanted to have their childbirth with a traditional midwife so that they didn't have to wear a face mask in the hospital. And the traditional healers brought some creams that could help the medical health staff with the skin problems they had because of wearing face masks. And in all this, we have found that one of the very important effects of the pandemic is the fear, and fear affects the immunological system. So we have identified a way in which from traditional medicine, we can have this holistic point of view that a disease is considered rupture of the balance between life and the community. And so there are a series of massages that improve mental health and help to control fear. For example, there is a plant, or well, there are many plants, but there is a plant called Glauphemia glauca, which was submitted by Herb doctor 40 years ago to the Ministry of Health. It really decreases anxiety without producing tiredness and getting us to sleep. So, well, in 2007, there was a strong earthquake And there is a traditional system of improving mental health that was also used after this earthquake because there were many emotional and mental health problems that were tended to by traditional specialists that know how to deal with these problems. And many of these problems are treated in a comprehensive manner.
In 2003, there was a very big landslide in the community. Besides affecting the community, it broke that created a big explosion. And the medical health center invited traditional healers to attend to people concerning fear. More than 800 families were attended to with comprehensive care, taking into account rituals, massage, medicinal plants, etc. Besides, I'd like to comment that indigenous traditional medicine was used in 2020 in a community in city in the state of Sonora. It was the people were attended with successful experience with a contact indigenous community with their traditional healers in the area. They were able to transform the healthcare center in a COVID unit, attended to 40 people. They had no deaths, and they used preventive medicine to um, uh, including herbal medicine. In this way, they were able to stop infections. I won't go in depth in this experience because our intercultural link with Sonora, Martín Maldonado Perez, will talk with a lot of detail about this at 1720. In this regard, we would like to comment that we have prepared intercultural guidelines for health care of indigenous and Afro-Mexican peoples in response to COVID-19. One of the important chapters is traditional indigenous medicine. And to finish off, we'd like to very much underscore that traditional indigenous medicine is still victim to discrimination, and many elements make it vulnerable and extract and rip them off many elements. And traditional medicine is the right that has lots of therapeutical power, not only medicinal herbs, but also others. And this means a lot of cost contention. This medicine is therapeutically effective. Many daily problems and transcendent problems are solved, and also public health is aided. And human treatment of people in this relationship with nature that is intimate and close and favored by indigenous traditional medicine. So thank you very much. Thank you, Dr. Garcia. We have questions that have all been already answered in your presentation. Maracames or midwives, are they working in hospitals in rural areas? In some states they are. We have hospitals where we allow and facilitate the work of traditional midwives to attend to births, but in many others, it's not the case. In Mexico, we acknowledge state autonomy. These are things that we cannot impose. We have been working a lot on this. In Puebla, you can do that. In Durango too. In Michoacán, and in places I commented, but not in other states. And this implies affecting this constitutional right of indigenous peoples of receiving care with their traditional medicine. Your microphone is off. Okay, thank you very much. Thank you very much. We have another question. You have mentioned that midwives are included in the healthcare system, but they say, how are they integrated in these healthcare services in Mexico? Well, in several ways. First of all, we have prepared a methodology that is called mutual enrichment between midwives and healthcare personnel. Healthcare personnel do not train midwives vertically. They just explain how they deal with birth, pregnancy, and newborns, and they see the advantages and disadvantages of both models and take agreements on how to apply this. And this has been applied in different ways. In some hospitals, for example, in the Cochala Hospital in Puebla, an area for traditional attention or care of midwives was created that was together. It was in a neighboring facility to the hospital. And with this strategy, we decreased maternal deaths to 0. In Durango, in an area, in 2013, there were 3 maternal deaths, and we trained with this care model to women with this intercultural and safe approach. All of the staff, from the director to the door guard, were trained, and midwives could participate. And from then on, there were no more maternal deaths. An example in Hidalgo, where through these meetings, we had very strong work of midwives together with healthcare center staff. They identify if the woman has a risk. In that case, she is attended by a doctor. If not, she is attended by a midwife, either at home or in the hospital. In Chiapas, it's the same case in 4 jurisdictions. There are maternal health houses for midwives to participate. So there are different strategies that facilitate care for indigenous women through midwives in very good safety conditions. Very good answers. Thank you very much. A pleasure to listen to your presentations, very didactic, updated, and showing the world the progress being made on traditional medicine. And Mexico is always ahead. Thank you very much, Dr. Garcia. Now we will go to the next lecture. It'll be shared by Dr. Emma Marcela Perez Conguache. She is from Guatemala. She is a doctor and has graduate studies in intercultural health. She has coordinated projects regarding health and indigenous peoples in Guatemala. She's coordinator of interculturality and indigenous peoples in the Ministry of Health and Social Aid in Guatemala. We will ask Dr. Perez to activate her microphone and share her screen.
Por favor, la doctora Emma se encuentra en sala.
Are you there, doctor?
Sí, bueno, ella ya se está
Yes.
Conectando.
She's connecting.
Sin embargo, mencionar a todos que
I'd like to mention that After this, we have two talks and then clarify that we are transmitting in YouTube both in Spanish and English. The English goes in the Capsin YouTube. And we have activities this afternoon too. We will share experiences with Latin American countries. So do not disconnect. Stay with us. Marcela, you have the floor. Can you please share your screen and activate your microphone? Thank you very much. Your microphone, please, on the right side of the screen, please. Okay, very well. And you can also put your presentation on a full screen. Thank you very much. Good morning to each one of you. It's really a pleasure to be able to participate in this summit. On the other hand, to share some of the experiences developed in traditional medicine and indigenous peoples in Guatemala. I'm going to put my presentation, okay, in full screen. I hope you can see it. And so that we can continue. We can see it. Thank you very much, Doctor. Very well. Thank you very much. Really, in Guatemala, as in other countries in the region, we have tried to make progress and articulate efforts coordinating indigenous knowledge from peoples in Guatemala. And this is very important because Guatemala is culturally diverse. On the other hand, there is an important pluricultural context. Doctor, excuse us, you have two devices, so we have that are on. We have echo. Perhaps you have a mobile phone or a video, please just the computer, or perhaps you can use headphones. In this way, we can hear in a better way. Thank you very much. Okay, very good. Thank you. I made that change now. As I said, Guatemala is a country which is quite diverse. On the other hand, there are social cultural characteristics that are very important. I hope you can see my presentation. Yes, yes, we can see it. We only see the title. Perhaps you can go on showing the other slides.
En el botón de, o si no, con las flechas de continuar.
You can use go on arrows.
Ahora sí se ve. Excelente, Marcela.
We can see it now. Very good, Marcela. Thank you. As I was saying, our country has very diverse social cultural characteristics according to the INE census. 46% of the population is indigenous. Out of this 46%, we have four peoples, Maya, Garifuna, Xinca, and also we have the Mestizo people among our cultural diversity. Maya people have 25 language or linguistic communities. 22 are Mayas, one is Garifuna, one is Xinca, and one is Mestizo or Ladino. These are some contrasts in the region due to their multicultural, multilinguistic condition. This means that the country, and also the country has large inequality gaps, both at social level and in other areas. Some background concerning how traditional medicine was promoted in Guatemala. The Ministry of Public Health and Social Aid in 2002 and 2005 started promoting a number of efforts at institutional level to foster the traditional and alternative medicine program. This program aims at studying, researching, and promoting regulations of traditional medicine in healthcare services to value, acknowledge, and respect this knowledge, wisdom, and practice of traditional medicine in the country. We also develop scientific evidence to be able to make it develop. In traditional medicine in Guatemala, we see this medicine as the one that is practiced and acknowledged not only by our parents, the grandparents, but it's also part of the community's tradition and is a result of many years of study in which traditional therapists of Mayas, Garifinas, and Shinkas have treated diseases with different techniques and practices to be effective. Can you tell me if you see the following slide, please? You're still in the context slide.
Sí, si puedes con las flechas del...
Please use the arrows in your keyboard. Also, in our coordination with traditional ancestral medicine in Guatemala, it's also important to mention that universities such as San Carlos de Guatemala University and some study centers, several decades ago, we started research valuing and rescuing social cultural practices in relation with indigenous health. This together with resources of traditional medicine. In this way, we have articulated several efforts between the Ministry of Health, also the rescue of traditional medicine promoted by ancestral healthcare systems in the country has been articulated to resources provided by the academia. In this regard, among the efforts the Ministry of Health is making, in 2010, following a ministry agreement 2009-1632, we created the unit of healthcare for indigenous peoples. It is an advisory unit on issues of cultural pertinence. The Ministry of Health is thus trying to promote and join efforts to foster traditional medicine in the country by establishing traditional medicine and the program of traditional and alternative medicine in the Ministry of Health together with indigenous peoples in 2009, we started to develop a number of strategies and mechanisms seeking mainly to acknowledge traditional medicine, traditional and alternative medicine. The ministry has two units. One is more technical and the other is more of advisory on intercultural matters. In this work done by the Ministry of Health, we have implemented a number of mechanisms focused on approaching the people's health systems. This does not mean that they aren't organized. Dialogue and effective relationship of different healthcare system players is still facing some challenges in the country. Talking about acknowledgement has been quite complex. On the other hand, there have been some important aspects I'd like to share as progress made by the Ministry of Health. We have respect for indigenous world visions, the unit of indigenous peoples and medicine and traditional and alternative medicine looks for acceptance of these services, and they should be effected, articulated, and in close coordination with ancestral medicine. In this regard, we have created a vademecum of medicinal plants. This vademecum started a decade ago in collaboration with San Carlos de Guatemala University. It has been published as the official list of plants with medicinal powers, and this has been articulated between our government institutions and indigenous populations. This vademecum gathers 120 medicinal plants. On the other hand, it describes some specificities such as chemical composition, toxicology, therapeutical indications, and on the other hand, medicinal use of plants and their botanic characteristics. This has been quite an important document for the ministry. It has been updated, and we have also created other mechanisms to get to know and understand indigenous people's practices. This is why we have to go in depth in their world vision. There are considerable differences in how they conceive time, space, cold, heat, coldness, heat, life and death in a sacred interpretation of life different from the Western concept. This is how, within the mechanisms, Doctor, we're having a technical problem. Can you share your slides again? They are stopped in one of the slides, and we aren't able to see your complete presentation. Very well. I'll restart. I'll share it again.
Vamos a ir solucionando el problema técnico que tiene la doctora Marcela, que nos estaba compartiendo.
Marcela is solving her technical problem. She was sharing very interesting information on progress made in Guatemala concerning traditional medicine and its insertion in the healthcare system and how they are tackling with other aspects concerning botanics and how they have organized information on medicinal herbs through the Vademecum. Perhaps, Doctor, you already have your presentation? Thank you very much. Okay, then let's go. Let's continue. Excellent. You have the floor. Just activate your microphone, please. Yes, thank you very much. Yeah, I've been having some problems. Sorry. Yes, sure. Thank you. As I was telling you, the Ministry of Health has promoted a number of strategies, among which this vademecum of medicinal plants. On the other hand, a number of very specific interventions have been developed. I don't know if you can see my other slide. You're still with the vademecum one. Well, we have had some dialogues as a mechanism to acknowledge and value ancestral or traditional medicine. We have done this through intercultural dialogues that propose a forum for exchange with ancestral therapists. In Guatemala, when we talk about that, we allude to all the specialties that make up the health system of indigenous peoples, like time, a counter, spiritual guide, the grandmother midwife, who has a very important role for taking care of mothers and newborns. And through these dialogues with the health actors of indigenous peoples, we have built some documents and guidelines, and we have done so in coordination with them. We have a proposal of intercultural dialogues to have the people's communities and community promoters participate in planning and improving health care so as to strengthen cultural relevance in our healthcare system. On the other hand, among the efforts made to promote traditional medicine in the Ministry of Health, we have included guidelines with cultural pertinence in the primary and secondary care levels. And this has a specific part or section concerning cultural aspects with phytotherapy, with 40 plants that are the most used in the country. They have also been acknowledged and are acknowledged by communities. On the other hand, among these efforts made, we now count on guidelines that are feasible and make the use of traditional medicine operational in our healthcare services. However, this is still part of some processes we are working on in the country. This is ongoing work. We are coordinating with traditional healers in a very significant way to generate and build all these processes. The intercultural dialogue tool is an important mechanism that helps us approach therapists and grandmother midwives that lead us to get to know this knowledge at community level, but also it's a political acknowledgement because it's part of the demands of indigenous peoples. In this case, those peoples own healthcare players. This has been developed in recent years. There are a number of limiting factors here. Why Guatemala, due to their social cultural characteristics, has had to face a number of challenges during this pandemic. And this is how we tackle with the preparation of a social cultural guideline for preventing and containing COVID-19 in indigenous peoples. This social cultural guideline aims at providing a better approach of this pandemic in the community so that the healthcare personnel can have specific guidelines to be able to coordinate and articulate with healthcare actors and indigenous peoples. There are a number of publications made concerning treatment and prevention as indicated by indigenous therapists. They very much emphasize prevention with medicinal plants that contribute to face this COVID-19 pandemic.
And yes, there are midwives that continue doing their work as midwives, as granny midwives, in a series of, well, they had to also establish a series of prevention measures that were necessary during the pandemic. The Ministry of Health also implemented a series of measures so that the granny midwives could continue with their work because the communities needed them. However, there were also many limiting factors because of the restriction measures. And parallel to this, it is important to mention that the Ministry of Health, through the unit of indigenous peoples, has established a series of actions also on emphasizing the importance of intercultural communication so that the indigenous peoples could count on the traditional healers and granny midwives to contain the pandemic. Sorry, I don't know why my presentation does not get stuck on this slide. I'm sorry I couldn't share it with you, but it's basically the experience that I can share from Guatemala. Thank you very much, Marcela, for your excellent presentation and for sharing the experiences you have in Guatemala. There is a question here, but I believe it's more of an opinion than a question. Why is it so that herbal medicine is a healthy medicine without side effects? Can you tell us a little bit about that? Well, we really emphasize, all the physicians, the traditional healers emphasize that herbal medicines are a very important resource, but they are more used for prevention and not so much for healing. They have been very emphatic in that. Each region has its own plant, and there is no standard recipe for each one. Each region bases its medicinal remedies on its own plants. Of course, there is an important resource of knowledge in the indigenous peoples for using these plants. Here we have another question. How do you articulate between the Western medical systems and the traditional health systems in Guatemala? Are traditional healers paid by the state? There are many attempts of articulating both kinds of services, for example, also the gynae midwives in the hospitals. But the experiences have not been very good because many of the gynae midwives that start working for a national health service, in this case in the hospitals, have been discriminated against, or they have even been attacked, insulted, and this is, well, a clash between the traditional way of thinking and the Western medical system. They have seen as inferior, but they have also been incorporated, but they have been incorporated at least in some areas. We have tried to achieve this articulation through the dialogue, intercultural dialogue with therapists. There have been very important experiences with health services, and it's the community area where we see this symbiosis in a better way. It has been quite an important and successful experience of coexistence of these two systems in the health facilities. Thank you, Marcela. It was very nice to have you with us. Thank you for taking the time to share your for sharing with us your presentation in this event. Thank you, Marcela. There will be some questions that we will send you through the internal chat so that you can answer them, because, well, the time online is not as long as you would wish it to be. But we thank you again. Thank you. We will now listen to Dr. Nila Heredia Miranda, who will share a conference called Articulation Between Ancestral Medicines and Official Health Systems. Dr. Heredia has a very broad curriculum. She is well recognized at national and international level. She has had some very high offices has held some very high offices at the University of San Andres, and she has also been the deputy dean for the School of Medicine at this university, and general coordinator of social medicine at Latin American level. Dr. Nila, it's a pleasure to share with you. She presently is the chairperson of the health care system of the oil company in Bolivia. Your microphone, please, doctor.
Bueno,
well, we seem to have some problems. While we solve this problem, this audio problem, that Dr. Nila is experiencing. Maybe we can share the video, or we wait for Dr. Nila. Apparently, she has put on her headphones, and now, Dr. Nila, please turn on your microphone. While we solve this technical problem,
podemos presentar el... Ya lo abrió. Ok.
oh, she has already opened it. Okay, thank you.
Por favor. Ya lo tiene abierto. Él está en el icono a mano izquierda en la parte de abajo. El audio, el micrófono en la
Nushka
pantalla.
is giving instructions to her so that she can open her microphone.
Por favor, entonces, Rocío, podemos compartir el video.
Well, in that case, Rocio, maybe we can share the video of the Kayawayas so that we can give Dr. Nila a little bit more time, and so we can show you what traditional Kayawaya medicine is.
Son los hijos del padre Akamani y de su nieve
They
eterna.
are the sons of the Akamani father and its eternal snows and the Mother Earth, the Pachamama. We're talking about the Kayawayas of the Oriental Andes of Bolivia, the Eastern Andes. Their origin is lost in time. They have the knowledge and take their wisdom to all the peoples. They know the mysteries of nature and have deciphered their magic. They live in Chari, Chahaya, Atawata, Inca, Curva, Miotarin, Carata, all these communities in the valley, in a valley between the mountains and the Amazonian plain. There is a capital city, the capital city is Island Chai, and the well, the geography is really impressive. They have 5 ecological levels from the lowland to the highest Andes. They have taken up this nature, this natural world in order to develop their knowledge of plants and animals and the minerals of their environment. They discovered their magic and their extraordinary properties and to synthesize also this alien knowledge with the knowledge of the lowlands. They know the power of plants, and they set up their own taxonomy and their own pharmacy. And many of these findings have already been incorporated into the Western medicine. They are the Kayawayas, the ritual healers of the Andean world, and they have acquired the fame and respect of all the American continent. Oftentimes despised and misunderstood, they have a traditional knowledge baggage that could help humanity with many of its new diseases.
Formaron un señorío propio en el siglo XII de nuestra era.
They had their own regional government during the colonial times. They were respected by the Incas and they served as intermediaries with the tribes of the Amazon region. They became the physicians of the Inca kingdom, and they were so important that they carried them on their litters. And during the colony, they were also privileged. The Spanish respected them because of their wisdom and used them as physicians. During the 19th century, they started their travels as traveling healers, and they went to all the parts of the continent. Their tours and the roads they followed have been registered in the whole of the continent. They helped in Colombia to train the shamans and healers in other countries also, and they even were invited by the academicians of the French Republic to show their wisdom at the fair that was carried out during the 19th century. And they were the army doctors of the Bolivian armed forces that participated in the frontier wars. They are members of an extraordinary culture. They talk the Puquina language, which the experts suppose is the old language of the Aymara culture. It is full of curative powers and also, as well as the music they have that they call cantus.
Para los Cayaguayas, todo
For the
cura.
Cayaguayas, everything heals. Everything reestablishes the natural balance between the spirit and the body, even the words and the spirits. They ask the spirits of the mountains and of their ancestors to help them. And as the man preserves all this wisdom from father to son, the women know about the textile art that were preserved, and their techniques will have been preserved over the centuries. The textiles are a very refined representation of their cosmovision and the knowledge of the environment around them, where they extract the colors. Nowadays, all these cultural wealth, this wisdom, is in danger because it can be lost forever. The pressures and the changes in their cultural environment and the imposition of a global culture is really making life difficult for them. Many young people migrate to the cities because they're tempted by modern civilization and they lose their traditions and their customs. And so they are accused by the pharmacists of being magicians and witches. So the pressure on them is because of these more powerful folk cultures. But the Cayaguayas have also always been mediators between the social classes. The Cayaguayas are the sons of Akamani and Pachamama, and the world has a lot to learn from them. If we have contaminated the body with new viruses, if we have lost our soul, And if we are lost in an Earth ecosystem that is strange for us, that is alien for us, we have to find our way again. A way of respect and exchange of knowledge between cultures, and a way of natural balance and peace among men, where well, this path starts in the Andes of Bolivia, and we have to support them. They are traditional life. They are the ones that heal, the Cayaguayas.
Muy bien, a continuación, ahora sí, doctora Nila
Well,
Heredia.
now we have with us Dr. Nila Heredia after a trip through the Andes. So we will now share with you this conference about the articulation between traditional medicine and present times. Thank you. Good morning or good afternoon. I'm sorry for the delay and the technical problems, but at the same time, well, this video is a very important video. It doesn't say many words, but it helps us to have better elements for reflection, because it's evident that the old knowledge is still there, although there is a great pressure on them. And this is an element that, well, the Western culture or the official system does not incorporate this traditional knowledge as only beyond the official discourse. Well, I want to make a presentation really, because I believe that this is a question of reflection and of information. First of all, I would like to speak about my presentation about Article 100 about traditional medicines in official registers nowadays, and the progress made during the last years. And well, at international level, we are seeing the success of the Western cultures. Mid-90s, the government got worried about indigenous health state. And although there were many efforts from different countries to achieve a better state of healthcare of its populations, the sanitary indicators showed different things, showed that the situation was different, especially in countries where a high percentage of the population was of indigenous origin. And this is also something that coincides with poverty in these areas, in these countries. And well, we all knew what the situation was in our countries, but the state started to explain this situation, and because the native population didn't understand the efforts of the state, so the blame for all evils was to be put on the ancestral knowledge, but the blame for the bad states of health of these peoples was because they themselves didn't know how to take care to take care of themselves. So they had a series of discapacities in that sense. So a series of structure theories were set up in the 19th century and 20th century that stimulates them, that sets up a series of measures based on capitalism to stimulate the native population and make the supposedly ideal Western culture accessible to them. It was said that Andean women were poor and were illiterate. So, and this is something that they used predominantly their own culture, their own language. So they were supposed to be, especially the women, were supposed to be the cause of malnutrition among their children, of all of the evils in society, of the bad state of their level of living, and it's evident that they were excluded socially. This classification became important when the states committed to reduce infant mortality by more than half and improve mother and child's health in order to achieve a decrease of maternal mortality rates with regard to the rate or the statistics of 1990. These commitments were part of the Millennium Development Goals, and the mechanisms defined in order to improve health were supposed to focus on maternal reproduction and not to solve the comprehensive problem of mother and child health. The general experience during the 90s and due to the decade of indigenous peoples declared by the United States, by the United Nations, the states developed different actions in order to foster interculturality. This subject appears like a very contemporary issue, it became fashionable to discuss interculturality, and it didn't generate policies that really make intercultural relations strong. And the same thing about this was the same thing in all the Millennium Development Goals. So it became interesting, however, and the debate among the states of PAHO derived in protocols and structures and regulations under the formal sanitation procedures. And this is where we see the reform of healthcare centers, of hospitals, of community clinics to the so-called assistance model, and under the forms of the model that was imposed on them. In none of these cases, the other actors were involved. So they didn't look for the equivalent of a knowledge of traditional healers. They didn't incorporate it into their strategies and into the practice and to the joint work, so that they could be visibilized, that these practices and ancestral knowledge could be visibilized. The owners of the other cultures, well, it was supposed to be a balanced relationship, but they didn't want to know the other cultures, and so it was not an intercultural
In
affair.
this way, they keep a vertical, excluding and self-sufficient practice, decreasing the responsibility of government, and just with cosmetic surroundings, plus perhaps the vertical labor and birth and nothing else. But within the limits of the official medical practice and attitude that is far from cultural adaptation and articulating knowledge, different knowledge. This is one of the trends. It's true there are significant efforts locally in valuing medical practices of midwives, of course, deducting their ancestral knowledge, including them up to labor, but their presence and action in healthcare centers or acknowledgement of their actions is mostly exceptional, not very stimulated, not very valued, usually without support and not protected by central levels. So experiences depend on medical professionals in those areas and a strong popular and community organization. This is the constant and continues being so. And I refer to this because articulation of knowledge, of different kinds of knowledge and different kind of medicine, it should occur in these cases. And I consider that that is the best time to make progress, put pressure, and adopt concerted mechanisms and actions. Besides reproduction, it should include all sectors in health knowledge with strategies, mechanisms, and incentives to overcome negative indicators and reach the fundamental right to health, which is the obligation of government. And this right goes hand in hand with other social rights. It can be reached through social, popular, communal participation that makes of health a flag of health for a future that is decent and fair for all. I'd like to repeat that articulation experiences, which are a few but very significant, and unfortunately, many have stepped back and find lots of difficulties. Why? Because the logic is related to pregnancy, labor, and birth, understood in a different way that is not the comprehensive care of women, children, and all the people inhabiting our countries. What is the state of affairs concerning countries in the region? Just to have a brief view of what's happening in the Andean countries, we can say that the 6 countries have incorporated and acknowledged ancestral traditional medicine in the political constitution of the state, national laws, decrees, and other regulations. And this is something acknowledged by all countries. All those laws and regulations that are just succinct in some cases and very developed in others, promote protection under the state. And unfortunately, they leave this under the responsibility and decision of indigenous peoples that are separated from official healthcare systems. So there's not really articulation. Very briefly, the plurinational government of Bolivia acknowledges traditional knowledge and medicine, guiding towards incorporating it in the universal and gratuitous healthcare system. The government has also created the Vice Ministry of Traditional and Ancestral Medicine. Chile has the law 2584 that mandates healthcare with cultural pertinence and religious aid, defining a number of regulations concerning respect and acknowledgement of traditional agents. It takes as something in indigenous peoples, but not cross-cutting for the entire country. Colombia also protects indigenous peoples and acknowledges them, guaranteeing their fundamental right to comprehensive health understood in their own ways. It creates its own system that is to be articulated and complemented with the social security general system to maximize achievements in health of indigenous peoples. So the system is not officially included in the system. It's separate, and it can be articulated to improve achievements or maximize achievements in health. Ecuador incorporates ancestral health, ancestral and alternative healthcare practices in its constitution and creates the intercultural and nationality centers for indigenous peoples so they can be included. Peru also incorporates this in its constitution. It acknowledged the importance and value of traditional and ancestral medicine and its exercise by indigenous peoples. It generates a political umbrella. But again, leaves this to medical bodies to articulate, but it has not made progress. Venezuela also supports the right of indigenous peoples to use their own traditional medicine and therapeutical practices, ordering direct participation of the peoples in the general health care. However, out of all this, well, traditional medicine and knowledge have been included in the national laws and regulations, but we can see that Bolivia and Ecuador incorporate them more decidedly with protection, acknowledgement, and inclusion mechanisms. However, in all cases, articulating both medicines are not visible or not sufficiently visible, perhaps it's complex to do so. Structuring policies that incorporate interculturality as a cross-cutting factor in health policies has made progress locally in individual decisions, and that depends on the presence of professionals decided to support this experience. Bolivia, that defined its policy as familiar, intercultural, and acknowledges health agencies, agents from traditional communities, decided to have doctors and specialists to translate political basis in constructing health for all. To this effect, it structured a program for educating specialists, that is, doctors graduated in medical schools could make residence in family, community, and intercultural health. And this is during 3 years in rural areas. During that period, they have to become imbued with culture, traditions, and relate to traditional practitioners to go towards health balance of people, families, and communities. Along the years with this experience, we have seen many significant cases. This set of students that then became residents have been able to generate very interesting articulation levels. However, they are in the provinces and regions and have no incidence in national policies because the ministries of health continues with the dominating canons with little courage to innovative and complementary practices. They don't conduct them, they don't make efforts towards them, they don't protect them sufficiently. So there's significant progress, but not within the official logic. And this is assistential biomedical logic that does not stimulate these experiences that are so significant. Ecuador has also incorporated articulation spaces with innovative local experiences. The same goes for Peru, but there's no sustained official light encouraging and supporting existing experiences. Generally, these local experiences are ignored and only occur in local places and depend on what happens with the general policies and depends on local authorities that might encourage, discourage, or let them be. This description is very brief because of time and does not translate the wealth of the numerous experiences which are not reported and incorporated in the official work in regular information provided by ministries, and then they become less important for most of the people, and its transcendence decreases at regional and national levels. And this does not show official efforts made by units related with indigenous peoples with no equivalence because of the huge and overwhelming structure of the biomedical model in official systems. So structuring guidance to articulate both medicines by the ministries is only applied locally and depending on how they are organized in the population. Undoubtedly, as long as respect for traditional medicine and knowledge is not translated to true facts, acknowledging their knowledge officially, we won't be able to articulate and have both medicines work in a complementary fashion. It's not sufficient to articulate. We also need to complement both kinds of knowledge. We can have a formal articulation, but complementing is a dynamic fact concerning respect of knowledge and practices of traditional local practitioners. This is true interculturality and an objective that needs to be built and that leads to a good life. A good life, that's what we call sumach causai. Our indigenous peoples teach us to love nature and to live a healthy life with everyone and everything. According to our opinion, the fundamental problem of official systems in all countries prevents articulating both medicines because of the difficulty of understanding the value of other kinds of knowledge. Is it possible to coexist in the current conditions after these 30 years of numerous and forceful declarations concerning respect for other kinds of knowledge? Apparently, very little is done. And one part is makes efforts in maintaining the biomedical logic with the centers that train human resources. I don't know sufficiently, but just a few medical schools incorporate respect and getting to know the philosophy of traditional medicines in their training and not just a lecture here or there, so that the people who are being trained know that there are other kinds of knowledge that are respectable, and that therefore when we build everybody's health care, that needs to be incorporated. I am a Bolivian, and we are very similar to other neighboring peoples in neighboring countries. And among our people, most of us come from some indigenous peoples. Perhaps we don't speak those languages anymore, but we come from them and we keep those habits. And this knowledge persists in the regions and in peri-urban areas. Apparently, official systems suppose that people who migrate to a city stop having their own culture, has left their culture and traditions in their villages, and that's not the case. Therefore, interculturality is a central line, and the peoples need to have the capacity to show their culture and make it visible, so that it's not only visible, but becomes a source of progress. I'd like to finish this talk by reiterating that the complementary character of interculturality, and interculturality that is feasible not from the Western point of view, because they frequently think they know and accept other kinds of knowledge, but they don't include them because they look at them from a superior point of view, and they assume that others are inferior, and therefore they don't include them in their daily lives, or even hides them, despite the fact that they know that such traditional medicine is effective. The fight of our peoples continues, and this path towards living well, living a good life, summa causa, that depends on how we articulate in the medical profession. Thank you for having listened to me and for having attended to all these thoughts. I greet all of our peoples present in this talk and in this Congress. Thank you very much. Dr. Heredia, it's been a pleasure to listen to your thoughts and how you manage these concepts on interculturality, complementarity, integration. According to your experience, do you think that we can be really complementary? As you have said, sometimes we think in terms of superior, inferior, I am right, you are not. Do you think uh, from your broad experience that we will be able to become consolidated and be complementary? I'd like to have your opinion, please. It's not that I believe that we will be able to do that. I'm sure we will. Our peoples are not the same as before. They have achieved, and we have achieved, to be visible. Indigenous peoples no longer, now participate in modern life and participate in the networks and in virtuality. And they have shown their lives, and they are making them visible. And the dominant culture, the Western culture, has built interculturality as a subordinated state mechanism of other peoples in a distorted way. But the peoples see this and they understand that achieving interculturality is not making concessions to live in peace. It is rebuilding state in a parity way between those that are supposedly dominant and those that are supposedly dominated. We have to build a new state with values such as reciprocity, solidarity, and so on. Yeah, we'll achieve that. Yes, I hope this is so, and we will soon have this complementarity of our medicines that have their benefits, and I hope we can be able to see beings as holistic beings of mind and body in connection with health and disease. Thank you very much, Dr. Heredia, for having accepted to be with us in your busy agenda in this second summit we are doing online. Thank you very much, Doctor. It was a pleasure to be with you. See you next time. Thank you very much also, and congratulations to the organizers. Thank you, Doctor. Now we'll continue with Dr. Oscar Velasco Hurtado. He will share in his lecture and information about a book he has written with other researchers. He's a specialist on medical anthropology. His research is on Andean medicine in Bolivia, and he has also educational projects on intercultural education, and he's the author of several other books. We are sharing the book on We Still Take Care of Each Other with Our Medicine. Good afternoon. Good afternoon to you all in the Andes and other countries participating in this summit. Greetings to Dr. Nila Heredia. She was one of the professionals in the Andean Healthcare Organization, and she was one of the most interested in this book. This book, called We Still Take Care of Ourselves with Our Own Medicine, was published thanks to the Hipólito Unanue Agreement in 2010. Consulting that resulted in this book was made by the support of the Andean Health Organization. The document of the terms of reference had this main paragraph, a blunt declaration. The intercultural health plan of the Andean Organization of Health, Hipólito Unanue Agreement, seeks to have all the population, particularly indigenous peoples, receive care from state institutions with the same rights, qualities, considerations, respect for their culture, acknowledgement for their knowledge and values, as well as other continent inhabitants and world inhabitants. The document shows criteria on current traditional medicine in Andean countries, providing analysis guidelines to comply with ORAS in the perspective of implementing the Andean Plan for Intercultural Health. A description of the knowledge and practices in Andean communities, well known as traditional medicine, was required, as well as the ways and resources these agents used for healing, and showing the importance of those knowledge and practices for indigenous peoples and the value they assigned to this as an element of pride and belonging to their culture. So we looked for information, and representatives from participating countries contributed with information and useful contacts of researchers or practitioners of traditional medicine in their country. We confirmed that the so-called traditional medicine included a variety of medicines developed in different ethnic groups and cultural groups that exist in our territories. At this stage, we accessed recording of a meeting of peasant leaders in a border town between Peru and Bolivia. They were discouraged. They say that the Andean culture is getting lost, that there's no respect of our authorities, and that they don't do anything to maintain our culture. But at the end, the healer said, but we still take care of ourselves with our medicine. And we took this phrase for the book's title. We followed writing the book, describing traditional medicine topics with a brief analysis and comment from the medical perspective, and when necessary with an anthropological analysis to broaden the vision on not very evident aspects.
The book has several, deals with several issues such as the Andean cosmovision, the Andean traditional medicine, the cultural health knowledge, the nosological model for diseases according to medicine, traditional medicine, the role of the traditional healer, and the concepts, Andean concepts about healing. And the idea was to show a series of practices and care methods. And it's not better or worse than a scientific method, but it is easier access to people without very expert medical knowledge. Going to the traditional medicine was always very important. So although this was done in hiding during the colonial times when the indigenous healing practices were prohibited, it was still part of our daily lives and it didn't lose its essence, although they had to assimilate many of the European models under pressure. And so the traditional medicine has continued existing, and it's still used by people. The traditional Andean medicine was very closely related with the cosmovision and strongly related to ethnicity. There is a very strong relationship with myths and ancestral traditions and the laws of nature. The several peoples of the Andean region up to now use their own habits and believe in their own myths and tell you and to explain to you the world and its functioning in their own way in order to explain the origin and the natural order. This and within this cosmovision, the Andean man is not the best product of the natural world. No, it's one being among others, and this places him among inanimated in question marks beings such as the mountains or the air or the water. And the Andean peoples communicate with these other beings through rites, and there is always a due respect for nature. In order to understand the Andean traditional medicine, you have to understand the context where it was developed in a territory that lies very high at very high altitude, and it demanded a series of strategies for survivals, both for individuals as for cultures. So the practices are full of this Andean cosmovision, and there is a very great importance assigned to family groups because a lone being could never have survived in that nature. So medicine, healthcare has more than one social function. Of course, on the one hand, there are resources and responses to take care of the health of group health and to alleviate diseases. And it's very close to religious practices, because one asks for the help of the other natural beings around you. So the healers have been an important part of the administrative community structure for many centuries. The ancestral medicine includes a series of knowledge categories, at least two. One, general knowledge that is acquired by all individuals and helps you to solve the simplest cases. And the other one is more complex, and it requires the individual to have been initiated in the rites, and the individual has access through a series of tests that he or she has to go through. Health is is considered a balance, a state of balance between heat and cold. Heat represents life, activity, and health, and cold represents weakness and death and inactivity. During the writing of the book, we found out that there was a very interesting structure of the body. There is the hayu, and well, it wasn't possible to describe it fully in the book, but that's the spirit, and the disease is depicted as a breakdown of the balance between the spirit and the body, because or as a punishment or as a disgrace that has befallen the individual. And it doesn't attack one organ, but the whole body and even the family. So the healing process tries to return the individual to the family and to the activities, the permanent activities. And this is achieved through a series of actions and and remedies with a diet or also with rites. The people in charge of health in the Andean cultures are very special. They are called healers or traditional physicians or traditional doctors or native healers or indigenous therapists. But what is interesting is all the quantity of names they are called in the traditional culture. That is lots. They have lots of denominations. There is a lot of there's the ones here on the slide, Yatiri, Jampiri, etc. And the healer tries to find out what is causing the disease and looks to restore the natural state of health through the resources employed. And of course, the healer will indicate when he start the diagnosis. In Peru, in Bolivia, the healers start by putting coca leaves into their mouth, and then they inform what the state of the disease is, and if they taste sweet, then the healing process will be successful. But if it's not, if the taste is harsh, then there could be complications or even death. So the role of the healer is analyzed in the book in a very extensive way. The healers, both men and women, also exercises the same activities as the rest of the community. So it's he or she is a peasant that takes care of the fields or of the cattle or the animals, the herd animals. So when he's not, or he or she is not with the patients, this person will exercise the same activities as the rest of the community. And one of the some of the more interesting characteristics are that this person is very has a very high level in the community. The community always waits for him or her when they are going to have a social function. And there's a permanent communication with supernatural beings, and the activity exercised gives these people a level of authority within the community. It also involves prestige and respect, and finally, it's the function that requires permanence and that really ends with the death of the healer. And The value is of the healer is represented by the following. The diseased person, the sick person, knows that he cannot participate in the family and social life because of this disease. He is not with the group, he or she is not with the group, so they want to get better in order to be able to participate in the family's life. And so the deceased person asks the family to call the healer, and the healer knows that this disease is hampering this person in participating in the normal life. And the family also knows the healer through references or personally, and they know that they will receive an answer from this person, so they call them to their home in order to take care of the sick person. So this role gives the healer prestige, and they also have to pay him or her. And the person gets to know the sick person and its family and his or her family. So the healer, when he does what needs to be done in order to restore the normal health status to the sick person, also strengthens his or her bonds to the family. So there are links between these three components, which is not the same as the community health caretakers of community paramedics have with the family. For example, if the person goes to a hospital, only the sick person can go into the room with the physician. And then, well, the family or the sick one doesn't know this person. It could be an older person or young physician, and this person, this physician, doesn't speak the same language, and the relationship is a very short one. The relationship ends when the patient leaves the room. And the relationship with the families, the traditional healers also set up rituals and engage in therapeutic activities together with the other members of the family or the animals. For example, here the healer also participates in rituals for sowing or for harvesting, and this could be in a variety of combinations. Then they can be applied together with a ritual that is more or less complex in a lower degree. And they have the same importance. The ritual is as important as the herbal remedy because the cultures of the area give very much importance to the ritual. They do not consider as an Andean healing only taking in a herbal concoction. You have to really engage in the ritual also. So but for urban people, for city populations, consider that the traditional medicine is just plant medicine and taking this or that concoction. And so the families do not consider that the sick one was taken care of if he only gets a physical remedy. They have to take care also of the spiritual body and of the family group. So if there is a ritual, he convokes all the family members, takes the necessary time to have all of them positioned around the sick person. And these sessions are usually very emotional on behalf of the patient and the family members. And the healer has to take the emotions of the group towards the desired end. That is to enhance the healing process. And he also studies the relationship between the sick person and the rest of the family group. And so he reinforces the family ties that are conducive to health. And the therapeutic resources come from herbal remedies that the Andean region has in a great variety. There are many plants, there are salts, there are amulets, there are offering rites to the deities, and the book brings a broad summary of these ceremonies. But as there are many elements to be considered, it doesn't describe them in great depth. And from the most sophisticated healer to the most humble one, they take care. The most humble family has at least two altitude levels to inhabit, a lower and a higher one, and you have to take the plants and the animals from these two spaces in order to in order to start the healing process. And there is a traditional health system. The indigenous and mestizo peoples use these traditions to take care of their health and prevent disease. So apart from a health system, there's also a state health system. But this is a cultural product, it is part of the Andean heritage, and it's very ethnocentric. The Andean healing traditions has responses for what we could call cultural diseases, and they are not the same that we know of in Western medicine. For example, this is the case of the COVID pandemic. And from these conclusions, we come to the fact that it is indeed necessary to continue the research. For example, the ahayu, the state of mind of the person, is not taken care of in the Western medicine. And why can why can the ahayu leave the body? How can it return to it? Another type of research that could be very important is the one about herbal remedies that fortunately is being done, and it's the best known part of the intercultural relations of the health staff. And although in the presentations from yesterday and today were more advanced than mine, I do have something to say about it. So I can come to some conclusions in order to promote the exchange of opinions. I would like to know what's the state of the intercultural health of Andean countries. We have heard a series of expressions that show us that it is being successful, but is this really reaching the indigenous families in the smallest communities where the health system is not very much present, the state health system? And another point would be what are we achieving in intercultural health? Are the regulations complete? They include the traditional healers? Do they have the same level as the Western physicians? The costs, are the costs accessible for those who need intercultural health care? Are the traditional healers and the physicians of the state system, are they paid the same? Have the traditional healers been included in the care provided by the state, or are they only called for certain activities? And finally, what steps should be taken in the future in order to establish the intercultural health plan as it should be. I want to end by showing you this picture of an Andean couple where, well, the man is Andres Hachacoyu, some person that was born in the IU, that is the Andean Administrative Populational Division, a very powerful man who unfortunately passed. And his wife is Doña Matilde. I knew her as, I got to know her as a midwife, a very knowledgeable midwife that solved all kinds of problems during childbirth. And apart from that, she was also an expert in rituals. For example, rituals with 1,500 people, where she could manage the emotions and all the intentions of the group, and also a great expert and a very good teacher about the essence of the science. She was able to know with all the aspects. And I would like, through these, a couple, to pay homage to all the people in the communities that are solving the health problems of their communities within the limitations of their knowledge. Thank you very much for the invitation I received, and with this, I end my presentation. Thank you. Thank you, Doctor, for having shared this experience of the book with us. The book is about self-care. Would you recommend some of these healing traditions of the indigenous peoples for their daily life? Yes, of course. For example, it's very good to drink herbal teas for cold weather, for problems such as fever or stomach troubles. But after looking at the set of data we have put together for the book, I would say that you can go to one of the traditional healers if things are more complicated. They're always there. They are in the market, on the street. You can ask anybody, and they know. And the important thing is that they really have a great experience in managing symptoms. They know the indications, the complications, and how these complications could be prevented, of course. Thank you very much, Doctor. We thank Dr. Velasco for his presentation and for sharing the experience of the book. And for all of those who are following us through the YouTube channels, we have put the link to the book that has been shared with us by Dr. Velasco, so that we can know more about the different chapters and be able to go into depth into the different treatments. Thank you again, and all of those of you that are following us through the networks. Please continue with us this afternoon, because we still have two panels, and we will be back at 14 hours GMT minus 5 through the networks, through the different networks. And for those of you who are saying goodbye for today, well, we are continuing with the activities of this second World Summit. And as we all have this very important contributions and the new technologies. The intention of the organizing group has been to reach most of the population, even in those areas where it is difficult to access this event in the physical, this event in person. So we leave you to have lunch, and we will come back in the afternoon. This afternoon, we will have a panel dedicated to the South American region and some experiences of the traditional physicians regarding issues related to health. Thank you very much, and we meet again in 1 hour.